All right, then, if we ready to go ahead and start, Rebecca.
We're on.
Welcome, everyone, for the Waunakee School Board meeting. I'd like to call the meeting to order on Monday, June 22nd at 6 p.m. All board members are present except for Mark. He's still not here, but we expect him shortly. And the first motion would be to approve the agenda with the one change that we have in the agenda comment section. Oh, I got to get all the way to it. With a dialogue on H with Dr. Jeff Pothoff that we would like to move to the front of the agenda due to his attendance. Is there a motion to approve the agenda?
Motion to approve the agenda.
And second?
Second.
All in favor say aye.
Aye.
And those opposed say no. So with the change of moving H to the front of the agenda, we will have it approved. First, though, we do have to do the public comments. There were several public comments that have been emailed into the administration. They will all be reflected in the minutes of the meeting. There was one comment that specifically stated they wanted it read. So from Ashia Dale on Friday, June 19th, she stated, would you please read as public comment on Monday? I'm Ashia Dale. My 3 children attend Heritage and the intermediate school. I would appreciate consideration of multi-age learning with families staying together and an outdoor option that families may opt into. An outdoor option would require children and teachers to dress for the weather and may need a reduced day. Students may not need to wear masks. There's lots of research that outdoor is safer even without a mask. It may require a shortened day or modified school year, for example, end the school year when weather is 0 degrees. Yet children may be able to attend more consecutive days than if only given indoor or online options. Thank you, Ashia Dale. And like I said, all the other email comments will be in the minutes and have already been emailed to all the board members. And are there any others, Randy?
No, there are no others that have come in since I sent those out to the board at 5 o'clock. I would just reflect that the other public comments generally were around face coverings for students. There was some advocacy for and some that were advocating based on some circumstances with children that this may not be the best idea to move forward with. And then there were also some comments from alumni with regards to our curriculum, particularly around diversity, race, and ethnicity, and wanting to bring that forward for the board to consider. Both of those alumni I've reached out to and will be having a conversation with them in person, hopefully in the next few days.
All right, then we will move on to item 5. And as we amended the agenda, we're going to jump right to item H, which is the dialogue with Jeff Pothoff on school-related COVID-19 issues. Thank you for attending, Doctor.
No problem, guys. Thanks for having me.
Yeah, well, I just want to start off with, first of all, thank you again, Dr. Pothoff. Kurt Ely and I had an interaction with Dr. Pothoff earlier in the COVID experience, probably back in March. Dr. Pothoff has some children in the school and was responding to some of the communications that we were sending out. He's certainly been an active participant in his work through the UW with the work on COVID. And recently, as we've been starting to get really different perspectives on what's happening with COVID-19 as it relates to schools, Kurt and I reached out to Dr. Pothoff, and he found some time to meet with us. And I found that meeting extremely valuable as we really talked about a breadth of items from face coverings to wellness checks to really how COVID impacts children, and then certainly wanting to just see how we could continue to keep a dialogue with Dr. Pothoff and potentially some other of his colleagues throughout this process so that we can really discern fact from kind of making decisions as we move forward. As I spoke with Dave in preparation for tonight's meeting, he recommended I invite Dr. Pothoff to the meeting to just kind of provide a little bit of an overview of some of the things that we've talked about in the conversation that Kurt and I held with him, and then also see if there's questions that members of the board have. So I guess from that perspective, I mean, Dr. Potoff, one of the things we talked about was face coverings, and I know that's been certainly a piece that we've had public comments on here tonight that were in favor of that protocol, and then also those that have some concerns about it. In the last meeting when you and Kurt and I met, you had some discussion with regards to working with some of your colleagues on some of the mitigating factors around that in the school setting. And I just wanted to kind of give you an opportunity to kind of share some of the perspective that you have on that, particularly around children and staff in the school setting, and then see if the board has anything that they would have questions about with regards to that, because that's going to be a big policy decision that we have to make at a point here in the near future.
Yeah, I think masking, the evidence behind it is pretty good, especially for individuals who are not yet symptomatic. So we know that with COVID-19, there's a 2 to 4 day period before you start having symptoms that you're shedding virus, especially your adults, your staff, where if they're masked, we know that decreases their ability to transmit to other people. I think the jury's still a little bit out on if you are truly healthy, how much benefit does the mask give you on not getting the virus? There's some studies out of Asia that says there's some benefit. I know the CDC is looking into it now that everyone's practicing this to see what's there. In general, there's probably a modest reduction in folks who are not sick and wearing a mask and not getting it from someone who has the disease. I think the public health recommendation would be that, when in a social situation such as a school, especially indoors, where there's the potential to be cohorted closely to other individuals for, any length of time, you measured in minutes, more than 5 minutes or so, that we'd want people to be masked. And I think the particular difficulty, and this is what I hear from my infection control people, is that the younger your student is, the more impractical it is to think that they could possibly wear a mask all day at school. So when we think about high school students, maybe junior high, it's maybe a reasonable expectation that they wear a mask. I certainly think we'd probably want staff and adults to be masked in that environment. I'm not sure it's going to actually work for you as far as kindergarten, maybe first grade, and who knows how far that goes. So that increases risk a little bit, but I think you'd have to then lean on other mitigation strategies, whether it's real rigorous physical distancing for those grades or other things that increase distancing. Because I'm just not sure. Looking back at my kids, my kindergartner, I just don't know how that mask works all day. So I think that'll kind of be the trick that you guys end up facing as leaders in the school is on every measure, you're probably not going to be able to do it perfect. I think you're going to have to take, your best stab at what is the best intervention with the health and safety of the kids, the staff, and their parents in mind, and then move forward with it. I don't have an answer yet for you on what we should do with kindergartners. That's how tricky the question is. I think our infection control people would love to say that they should be masked because that would be exactly the right thing to do. But I think we all realize from a practical standpoint that would be exceedingly difficult in those younger grades. It's just probably not something you're going to be successful at, even if you were to require it.
And right now, one of the things that we're looking at as we start to bring back this summer our camp kindergarten students, that's a protocol right now that we are looking at, partially to see kind of how that piece works, Dr. Potoff. I know one of the things that you were looking into was kind of the benefit of having the face covering, and then if you have children who are touching it and playing with it and moving it around, kind of the mitigating factors of how does that change the effectiveness of that as a preventative measure.
Yeah, and certainly the more you touch your face with the mask on, the more opportunity you have to infect yourself. That dovetails a little bit to what kind of processes are in place for sanitation. So the more aggressive the schools are in sanitizing surfaces and things like that, the less that risk is. But the real risk will be probably touching other kids and then touching yourself or things like that. There aren't robust studies on it that show it definitively. But if you just take kind of like basic epidemiological type data, your hands are the most likely source to be infected with the virus if you're touching yourself on the face that could infect yourself. Early on in COVID-19, That's what we were telling people, where healthy people shouldn't wear a mask, even so much that if you wear a mask and you're healthy, you might increase your risk, because we thought it provided really no benefit. And there certainly was at least some risk with touching your face. So I think that's it's a fair thing to think about as you think about what to do with your younger learners. Not only is it going to be hard to do, there could be, even if not scientifically proven, some risk with younger learners wearing a mask, as it provides something over their face that they're going to touch and then potentially infect themselves with. So I don't know if we'll get conclusive evidence by the time the schools start, but it's reasonable to think that for folks who find it difficult to avoid touching their face, they could increase their risk with the mask.
Okay. Jack, I'm sorry I interrupted you. You had a question.
What about face shields versus the mask? When you look at the younger learner, it might be easier to have a shield versus a mask.
Yeah, the shield probably won't provide a lot of benefit for some of that respiratory droplet. It's just too open. We use shields in healthcare, and the benefit of the shield is twofold. One, your mucous membranes are a potential source of exposure. So when we have healthcare providers close to patients, we want their eyes covered so that they can't, get coughed on and get it in their eyes. The other reason, and the initial reason that we went to universal face shields for our healthcare providers was it protects your mask from soiling. So if you're doing procedures and things like that, where maybe there's blood spatter or mucus or things like that, it gets stuck on the mask, and you can reclean that and reuse it, the face shield, reuse it. And it allowed us initially, when we had that shortage of PPE, to get more use out of our N95 respirators and our face masks, because they weren't getting soiled, the face mask was, and we could clean them off. The thing we found with our staff now is they don't complain about the mask as much as they do the face shield. Face shields tend to fog up pretty good. Once you clean them, the clarity through them starts to decrease a little bit. We found that the face shield's probably the least liked of the facial PPE that we have right now. People are okay with wearing a surgical mask. That's pretty comfortable. N95 is a little bit more arduous for a full day, but rarely required. Face shield, they make it work, but they like it the least.
Okay. Very good.
Is there a certain type of mask besides the N95s that are most common that we're seeing people wear that are effective?
Yeah, I think if you can get anything that's like a surgical, so N95 I wouldn't necessarily recommend for folks at school. They're a little bit thicker, and then as they get condensate in them, they become a little bit more difficult to breathe in. And in the school environment, where ideally, between your screening and a low prevalence in the community or lower, it's probably not adding significant benefit. In fact, we don't even use them in the hospital unless we have like a known COVID positive or someone that we suspect, and then we're there on doing a particular type of procedure that would aerosolize the virus. So the surgical face masks are pretty comfortable. They're probably, the commercial paper ones are probably more effective than cloth face masks. I think at this point, the supply chain is short up enough where that's probably something that might be available to schools. You got to be careful about your vendor, because sometimes the price is hugely inflated right now. So get a good deal. Those are probably more effective than cloth face masks if for logistical reasons, or it was easier for students and families to wear cloth face masks or masks that they have off of Amazon. Maybe they want to wear something that is stylistic. The protection is probably a little bit lower, but probably not enough that we would need to worry about it so much. Our position has been, anything over your mouth is going to catch most of those droplets. So we haven't squibbled too much around which fabric to use. We've given people that choice as it comes to like regular protection. Now, if you're taking care of patients, then we require our staff to use, products that we know are good infiltration. But in a school environment where that risk is lower, I don't think we would feel strongly that you would need to use, full-on surgical masks with really high ratings. I think as long as you had any kind of, double-sided fabric mask, you'd probably get close to the same benefit, maybe for less effort.
One thing that came through this week is the Department of Public Instruction has an allocation of masks from the state. Mm-hmm. And so I believe we have an allocation, John, is this correct, of 9,000 of them that are coming our way?
That's correct, Randy, about 9,000.
Okay, so there's, we've obviously had to purchase some, and we've continued to do so, but we've also have a supply coming through a channel through the Department of Public Instruction.
And would you expect those masks to be a one-day item?
That's an interesting question. So, when we had our PPE shortage, our guidance was a little bit vague on purpose to basically say you can use it for as long as it isn't soiled and it's still functional, it's not ripped. And the reason we did that, and maybe this would exist in the schools, is different people work different amount of time. Someone might only work a couple hours a day. Someone might be working, the full day. It would for sure last the day. It wouldn't be unreasonable for it to last about a week. Assuming it didn't get soiled. So you'll have a certain percentage of those that end up getting soiled or torn or whatever, and they have to be replaced. But we've found that a reasonable expectation for a mask is about 7 days. And then at that point, you should probably think about getting it replaced.
The ones we're receiving from the state are cloth-like and will be washable.
Yeah, even better.
What are we looking at in terms of COVID affecting this age group that we're talking about in our school district, and who's more susceptible, with underlying conditions that we're?
Yeah, so your kids are probably the least susceptible, except for those kids who have specific medical needs, and then they might be more susceptible. We don't often see severe disease in the K through 12 group. Not that there aren't the outliers, and it's not that you couldn't have some really bad outcomes with a kid or two if they were to get it. But in general, we don't see as much in that population. Your staff are probably more at risk than the students. And then my screen is getting a little bit dark. Let's see if I can get to lighten up a little bit. So the staff are probably a little bit more at risk than the students. And then I think the other group of people who you probably know less about, but would maybe have the most risk, is whoever those kids have as primary caregivers in the home. If you had, young adults taking care of those, that risk is lower. Certainly if you had grandparents or other parents with comorbid medical conditions, they could be at pretty significant risk. And we know that kids are more likely to not show classic symptoms. So that makes it a little bit harder for us to identify kids just based on symptoms alone if they're not going to show as many. We also think, we don't know, that those kids are maybe a little bit less infectious or contagious than, say, adults with the same symptoms. We don't know that for sure, but I know some of the stuff that was coming out of Sweden was that they didn't have as much spread out of the schools as they would have thought. But we don't know enough about it to know if that makes kids less infectious, or if people in Sweden were just being a little bit extra careful because they thought that they were at higher risk because they had kids in school. We don't know that, but that's kind of the things we know about the kids. So kids less likely to get infected, but I can't tell you for sure it won't happen. Your staff and all the people working at the school would be more at risk, and then probably the highest risk group is whoever's taking care of those kids at home. From the public health perspective, it's really that home group too that we'd worry about, because if you have cases within the school, that's a pretty small group that we can get contact tracing in, identify who those kids have been in contact with, get a hold of them, potentially do testing. If you have a cluster in a school and all of a sudden it went out to 20 families and they had different contacts, you quickly get to a group of people who need to contact trace that probably exceeds the ability of public health to take care of it all.
So are we seeing still the same issues with diabetic children, with older diabetics in terms of COVID?
Yeah, we're seeing diabetes is, when we look at the UW Health cohort, diabetes is the leading risk factor. We're seeing worse outcomes in diabetes than any other risk factor. And then I forget the rest of them. Hypertension usually comes out there quite a bit, but it might be related to how prevalent it is in the society, rather than something with hypertension causing more problems than other patients, than cardiovascular disease, underlying lung problems, asthmatics. But diabetes is one that we are seeing, at least in this area, a pretty high association with more severe disease. Also a little bit with obesity, likely related to the fact you already have difficulty with ventilation because you've got more weight on your chest. Oh. Did you get that, or did I break up, guys?
You broke up a little bit, Dr. Potoff.
Okay, let me see if I can get to a little bit better. You back in.
you're
Am I back?
Yep, you're back.
Okay. Let's see if that works a little bit better.
Awesome.
How much of that last answer did you get? Hopefully enough.
Half.
Basically, I'll summarize it. We've seen a lot with diabetes, a little bit with obesity. Those are probably our two biggest risk factors that we're seeing here in Dane County, and that could be because of our population and our demographics. Nationally, we are seeing it with folks with cardiovascular disease, heart failure is a particular one, and then underlying respiratory problems, asthma probably being the most common.
Yeah, I guess my question was more that, are we more of the concerns of the children? Are we seeing that same thing we're hearing about the older adults having severe problems? Are we seeing kids who have that same disease having the same issues, or are they more resilient?
Yeah, they'll have the same issues, but at the same time, they're more resilient. So even though they have those issues, they don't seem as a population to be getting as sick as the adults with the same issues. So if I have a kid with diabetes, more likely to have more severe disease than a kid who doesn't have that. But at the same time, we're not seeing, even with those kids with comorbidities, as severe as disease as we're seeing in older folks, especially older folks with comorbidities.
So would it be fair to say that a lot of the risk that we're undertaking with children is the transmission of it to adults who they have interaction with?
Yeah, I think that's a fair statement. I mean, not that you might not have a bad story with a kid, but if you speak on the population level, looking statistically at it, it's more likely to be your staff and who they take it to than the kids themselves having severe disease.
Okay, very good, very good. Another decision point, Dr. Potoff, we have to make is really kind of screening kids as they come to school. When Kurt, you and I discussed this, we talked about self-monitoring checks and then also a thermometer check at the door. Through our conversation, that was actually our recommendation that came out of our last board meeting, was to do self-monitoring checks from home where parents sign off on certain conditions. And then we have a process really to kind of use that as kind of a ticketing system into school, as opposed to some of the thermometering at the door. And you and I had a good conversation about some of the pros and cons to either side. Can you just speak for a moment to kind of the direction we were going? And at that point, it was you were supportive of our approach.
Yeah, right. So, you know, at UW Health, we had this conversation a few months ago, and initially we took some guidance from the CDC, and we wanted to do temperature screenings. We thought a lot about how to do that, the risk benefit of it. The risk is it can sometimes require a lot of staff to do that, and you have to avoid setting up a queue or a line as they come into school, or you kind of defeated the social distancing, which is probably more important than the screening. The issue we ran into with thermometers is if you use anything but an infrared thermometer, it takes too long, and there's really no reasonable way that you could do it with the staff that, at least that we had available, with the rate that the kids are coming in. They're just coming in too fast. With the infrared, you can do it because all you gotta do is hold it close to the forehead. It doesn't require someone else to touch someone else. But the staff that we've had come in, the patients that we have come in, their temps are always low because the infrared picks up the temperature of the skin, and oftentimes as they're walking into the building, the skin cools down, and we frequently are getting readings in the 95, 96 degree range, which are wildly inaccurate. That causes a lot of people to lose some trust in the system. It requires you to actually set a cutoff that is below a fever. So if someone has a temperature of 99, but that's not a fever, we hold them up and we rescreen them because we're concerned that the 99 might actually be 102. So despite all this work, we're actually not identifying very many people through our screening process with thermometers that turn positive. It's a fraction of a percent. So we're even actively looking right now at a way to do this more effectively and more efficiently, maintain the benefit that we think is there without expending additional resources that sounded good in the beginning, but actually just didn't pan out. So we talked about apps, but that became impractical because not everyone has a smartphone. We're really trying to target now some sort of attestation or some sort of declaration piece of paper that says, yeah, I'm checking myself at home. I don't have fevers. I feel okay. We feel like having that step in there is helpful because it incentivizes people to think about this before they just come to work. And for you guys, it'll help people think about it before they just send their kid to school. They know that people are watching. We've talked about doing spot checks on certain days at the hospital. That could be something to consider. But For the most part, I think you're probably not gaining a whole lot with any kind of elaborate screening process. The real benefit is probably in sending the message that, you're going to ask kids or have their parents send a note that says, are you feeling okay? I've been having fevers. Are you checking it at home? If you need to, you could have them enter the number. But yeah, we kind of went big on it initially, and it's just not panning out the way we thought it was going to.
Dave, are there other questions that you feel, or members from the board, that you have for Dr. Potoff while we have him here this evening? Those were some of the main topics I think we've had some discussion on that we wanted some feedback on. Is there anything else that's resonating with board members tonight that either we can run past Dr. Potoff while he's with us, and if he doesn't have the answer, something that he could find and bring back to us, or I can communicate to us at a point in the future?
Do other members of the board have questions?
What are the health professionals sort of thinking? The outlook with this fall with schools and colleges and all the athletes returning and that kind of thing. I can suspect what I think is going to happen, but yeah. What are the experts saying?
We're all a little bit nervous about it. I think the thing that we're seeing is, early on, I think folks were maybe a little bit more scared of this, and our compliance with some of the mitigation stuff was pretty high. We clearly flattened the curve more than I even thought we would in Dane County. But now if you're out and about, you see less adherence to some of these things that we need to do. I get it, it's summer and people have had enough of this. If we bring in all these learners, especially, the college learners, schools come back, we create environments where we could have an event where something starts to get going. These schools and other places that come back, they have a lot of people, so it could easily outstrip our ability to contact trace, and we could get back up on the curve. That's the worry that we have. As we get into fall, influenza is going to make things a little bit tougher. We expect that COVID will probably get a little bit stronger come fall. We don't know for sure about the weather stuff, but it seems like that might come into play a little bit. At the same time, there's other places in the world where they had schools running during their pandemics, and it didn't get quite as out of control as it could have. So there's risk there. But with all things COVID, it's the first time we've done this, so we kind of have a pretty good idea of what these diseases do. We're learning more about COVID every day. But I don't think anyone would put down their retirement on a bet on what COVID will do, just because we don't have quite enough experience with it. But we're a little bit worried about all these learners, all these students coming back, everyone cohorting together, and if that'll cause us problems or not.
Thank you.
Doctor, I'm kind of curious. One issue we've talked about is what would happen if somebody did test or come up positive within the school or was at the school and ill. And there was some thought as to how would we handle that person. We do have a wellness clinic and we do have Dean Clinic in town. If we wanted to test someone as part of a procedure or stuff, how long would results take now?
Yeah, it depends where you get tested, and that'll depend probably on whether the school has its own testing infrastructure. That might be difficult, but that would be pretty rapid. If they are, so let's say they have insurance that works at UW Health, that would come back same day. If they don't, and Alliant Energy is still open, they're using the same testing, but they have more logistics in there. So that's been taking sometimes days to come back, which could be problematic when you're thinking about whether or not you can have a school open or not. So it would kind of depend where the testing is. The testing in general is much faster now. The actual test itself, we have rapid platforms at UW Health that we kind of use in urgent situations. We get test results back in 45 minutes. Our high volume testing platforms, we get results back in 4 hours. So it's not so much the test takes so long to run, it's how long does it take you to collect the sample to get to wherever it needs to be tested. Once it's tested, how do they communicate back to you the result of that test? Those things at this point seem to be taking a little bit longer than the actual test itself.
Thank you.
So the numbers that we're seeing, I'm sorry, Dave. So the numbers that we're seeing, I get alerts every day on COVID. So I see that it goes up, the 2.9% of all tests. Are the tests pretty much about the same that are being taken each day? So when I see that it goes to 429, is that a difference in the number of tests, or is that pretty consistent?
Yeah, it's a great question. So there's things that drive that. So in our command center, we watch state of Wisconsin, but we also break it out to South Central Wisconsin, and we break it out to Dane County, because what happens in one part of the state might confound your data and might not help you make good decisions at the local level. So you probably want to get data that's more specific to Dane County or South Central Wisconsin, so that something happening in Green Bay doesn't have you thinking that something different happened in Dane County. You will have that day-to-day variation. The number of tests per day, the one thing to note, and it might actually happen in today's data, is the Alliant Energy Center doesn't do testing on Sundays. So Monday data is usually percent positive minus anyone that would have gone to the Alliant Energy Center. As you know, the Alliant Energy Center doesn't really have any parameters on who they test. So if you're anxious or if you're curious or if your employer requires it, you can go there and get tested, and those people probably have a fairly lower than the general population, a positive test rate. So it would pull that number down. So as of today, so today's Dane County number was 9.8% of people tested yesterday were positive. That's the highest it's been since our record day back in April. We're watching that because we did see statistically significant increases both in South Central Wisconsin and the state itself today. But it's only one day of data, so we need to trend this at least for 2 more days to see if that happens. But one of the things we thought about today was that Dane County number, maybe because most of those tests are coming from physicians' offices, emergency departments, places where people probably went because they had more symptoms, which would then lead to a higher positive test rate than, say, Alliant Energy, where you might be going there because your employer said you needed to get a test before they let you come back to work. So the testing is tricky, and where you see in the media, they will give you that percent positive, which is the right way to report it. But they usually give it at the state level, and that's just probably not specific enough to make decisions in Waunakee or Dane County. You kind of need to know what's going on here and what the trend is with that.
Thank you.
Are there any other questions from the board? Then I believe the other part of this was Randy, talking about putting together a small group to give us advice on medical as we go forward.
And that was a conversation that Kurt and I had with Dr. Potoff of where there's some folks that had children in our school district who work in the medical field as he does, that could at different times just be a place where we could use as a sounding board to get some advice. And I know that there are some folks, Dr. Potoff, that you've reached out to in your work, and I know that there's some others that we're certainly aware of that probably would have an interest in it, and also wanting to make sure we have some connection to our local clinic where many of our kids also attend. So that was just a piece that I know we've had some discussions about, and I know that there was at least one individual that you were reaching out to that potentially could serve in that capacity. But I think the piece that we discussed was just the value of having a place where we could have these conversations with people who truly work in this field and can at least advise us on some of the options that make sense.
Yeah, I mean, none of us pretend to know how to run a school. Like, that's not what we do. Even though some of us run hospitals, it's just different. But we do have a fair bit of wealth and knowledge around COVID. We're up to date on kind of the latest things. We've got pretty good data in front of us. Really, to kind of do what you did here is if you have questions or you hear something and you want to know, is this a good way to go or not a good way to go? That's where I think we could add value to your group, is basically just to let you know what we know, have a small group that could be somewhat advisory to you guys as you try to make decisions about what to do for the school district.
Well, I'm sure we'll be taking advantage of that. So I guess I'd like to thank you for your time and your participation, and we look forward to working with you as we keep working on this.
Yeah, sounds great, guys. Yeah, I'm sure you'll do a good job. It'll be hard stuff, but I think we'll get it figured out. We got a lot of good people working on this.
Thank you.
Thank you.
Thanks, guys. Bye.
So we'll go back to the regular order of the agenda, which the next item A was about what came out from Public Health Dane County today.
Yeah.
So Randy, if you want to go through.
Thank you. Now, let me give you kind of a high level of tonight. I mean, certainly we started off with Dr. Potoff. I was talking to Mike earlier today, and he just had a question of kind of where were decision points this evening. I think a lot of what you're going to hear this evening is really an update to really kind of lay out a large scope of work that we've been working on for the last number of weeks. And we feel it's important for you to kind of see the work that's starting to develop, and certainly you'll see some of the natural decision points that are also going to come forward. The pieces for kind of this to be kind of keeping in your mind, where I would like some board I guess action or affirmation is just around adding some additional programs to our work in July specifically. And then obviously we're getting into some of this policy development. And I think that has really two prongs to it. One of them being what we're doing in July, particularly as we look at even our own staff who are here now, and then any program that we bring back in the July timeframe. And then certainly any sort of revisiting or final affirmation of our policies. That's probably at a future meeting that then looks at some of the things we talked about with Dr. Potoff that we will then set as policy items for the fall. But to jump in and start looking at really what are some of the guidelines, I'm going to take a very high view of this. I'm going to share my screen to do it. And we'll kind of be bouncing back between board book and a presentation here. The first thing is when you take a look at our guidelines, obviously the Education Forward Plan from DPI came out today. How I would categorize that document is really a framework versus a lot of specific guidelines. It's really kind of breaks it into different categories of work that we have as a school district, and looking at the complexities of operating a school and all the different pieces that we need to take into consideration as we navigate reopening our doors as we move into the fall. And then some things that I view as kind of checklists, pieces where they pose some questions that I think are good for us to be having top of mind as we put our work together. And then certainly there are some guidelines within there too. But if you're going to look for strict guidelines per that document, there's not significant ones in there. There's definitely a deference to local control and basically responding to the platform in education right now that is regionally based. That as you start looking at public health departments, those are based at the county level, and each county is really in charge of making decisions for their populace within their borders. So for us, Dane County is really our deciding factor. WIAA also came out with some guidelines for the summer. I would say that the best way to articulate that is that's just really articulating levels of risk that districts would be taking on if they engage with different levels of activities, and also trying to gauge it based on where a local health department might be placing its level of involvement that they want to do. I thought that guideline was actually very helpful with regards to us starting some things in July. It gives us another point of contact to put some pieces in place. Definitely respects social distancing and breaking down programs into low, medium, and high risk activities that all have different guidelines to them. But it does stop short that I know that a big piece that's on people's minds is what's coming for fall sports. My understanding is the Board of Control for WIAA is meeting this week to discuss that. In a superintendent's meeting I had that was statewide today, there was definitely a voice being forwarded that to try to build some consistency so that it's not fully just a local decision by every school district, but can be something that can help us to address this on more of at least a regional level. Because as we start moving over county lines and having different rules, it just becomes very difficult for us to navigate. But the piece that we have to keep our eye on is what's happening with public health, Madison-Dane County. Those guidelines were supposed to be out today, but they have postponed them until the end of the week. I believe what they're looking at is trying to make sure that they align as closely as possible with some of the things coming out of DPI. The number one thing that I think we're looking for from that document as a public health department is group size and classroom size limitations. That drives really everything else. That drives how we set up our instructional program, which model we're able to move into, really based on what groups of kids, how many can we bring back at a time and in defined spaces. I also anticipate some recommendations on things like face coverings, wellness checks, and transportation, but I think all of those will stop short of anything that has a requirement. It will be recommendations, and then it will be deferred to really a local decision as far as how you want to handle those. But the group size piece is a part that I know is what we're waiting for. I also am aware that through my meeting this afternoon, some of the class size ratio numbers that were in the DPI document, at one point they referenced 10-to-1 with special ed staff and special ed students. That piece is already being revised because it's creating some issues as far as what it actually means. So the team that worked on that is going to be rewording that and re-releasing that. DPI shared that they would do revisions every 2 weeks, but they felt they may do one sooner than later on that issue because that's such a key piece for us as a school district to be planning forward with. So these are going to be guidelines we need to be kind of following. They're going to be, in some respects, specific, and in many respects, they're going to defer to us locally to make some decisions on things that we've already discussed tonight, like face coverings, wellness checks. Transportation is one that we'll have forthcoming here in the near future, too. Any questions on guideline pieces before we move on? All right. One of the pieces that we need to take a look at, and I'm just going to keep walking through this if that's okay, Dave. The next item is the policies. There's 4 policies that we need per the forward game plan to have in place. A hygiene policy, a cleaning policy, a protective measures policy that's really directed towards staff, and a documentation process for training of staff. These are really geared towards our facilities and our workers and our staff in our buildings, primarily because these 4 policies are required regardless of the sector of opening in the county. So if you're a restaurant or in healthcare, or if you're in a health club, you have to have these same policies for your business, and that applies to schools as well. So I know that there's some other pieces on the next slide that'll kind of get into some more specifics, but I wanted to see, are there any questions on the hygiene policy, the cleaning policy, the protective measures piece for staff, or the documentation aspect of our policies? These are 4 that we need to have in place in order to bring anything back to our schools. Any specific questions from the board? Brian Grabarski, John Kramer, and Kurt Ely did much of the work on our policy pieces and included requisite staff, nurses, etc., to help put some of those together based off of some template language. Any questions about those?
Do we know how the staff and teachers are feeling about these policies? Or do we know face covering? I mean, maybe this isn't the place, but
yeah,
does it? I know it matters, but
it does. And I think one of the things that we're also looking to do, and it gets to your question, Brian, and I think Brian Grabarski, you might be able to weigh in a little bit too. We need to do, and you will talk about it later on in our agenda, a survey we're going to do with parents on some of the instruction delivery pieces. We also are going to be doing a survey with our staff that really starts looking at some of the accommodation pieces. But certainly what we need to communicate out are some of the things that we have as recommendations in these areas. I think just as we can anticipate parents having differences of opinion on some of these, we can anticipate staff having those too. But I think it's as we kind of look at some of the guidance from Dr. Pothoff as far as people being, the receptivity as far as how things are transmitted. I think those are the pieces that we've kind of grounded some of our policy work to keep people as safe as we're able to. Any other questions on those policies? Okay, I'm going to move on to these. Here's a few others, and I'm going to ask a few people to kind of walk through really what they are. If you want me to bring any of them up, I'll just stop my presentation and jump over to board book to bring those forward. The health reporting agreement and employee illness policy, I know that was a piece that there was a question on. So Brian Grabarski, if I could just ask you to kind of clarify kind of what you have in those documents and kind of what your vision is for them.
There's really two parts to the employee illness policy. There's the policy itself, and then there is the second part, which is the employee health reporting agreement. Both of those are built off of shared resources from either the state or public health. But in particular, part of the conversation I had today with Joan when she'd asked me a question about the employee health reporting agreement is that when I attached the two of them, I really saw the employee illness policy as a policy, as it is fairly general language, which would kind of follow with the pattern that we have with our policies, kind of an overarching umbrella. And then the second part, the employee health reporting agreement, that first page that ends with a single black line at the bottom below employee name, signature, and person in charge signature would almost be like a rule that we often have seen in some of our other policies in the district, that this brings into light that the employee has seen it, they've agreed to it, this is what they're agreeing to. This particular, the employee health reporting agreement would be what they would sign off on via Skyward. Skyward is just our employee information system. This is, we would have them electronically note that they received it, that they reviewed the materials that are associated with it, and that they agree to follow it. There's a second page after the employee health reporting agreement that talks about work rules for ill employees. That was attached as an example. As you note, that comes from Public Health Dane County, and that is how they are operationalizing, or how they would suggest that we operationalize it. That was not included to be part of either of those two items. It's just there as an example of how it could be operationalized.
And going back, Dave, to a question you asked Dr. Potoff, I think it fits very well into here. If we did have an employee who became ill, certainly that is directly in the line with some of the work that public health would be advising us on, and also advising that individual on, as far as what they would or might need to do. Either with regards to testing, or with regards to like their ability to return, and what are some of the parameters around that. And we would work with them on those pieces.
Is there going to be any reporting that the school districts are required to provide to public health or anything like that on the number of employees? That would all come through the health centers, right?
At this point, I'm not anticipating that there's anything that we have to do, like continual reporting to them. We would have to report if we had somebody who came down positive, or
and was in our building.
And was in our building. So I think any of those type of exposure type events, we have a duty that we need to report.
So Brian, going back to our conversation this afternoon, the second page, will that be just deleted from the policy?
The work rules page?
Yes.
Yeah, that would, obviously that would not be yes, it could be just taken off. It was a jointly distributed document from public health, so that's why they're tagged together, but obviously we can choose to adopt whatever page we would want to adopt.
So I did have a question, I guess, about that.
You're talking about that page.
The second page.
To what effect would our requirements for someone who's showing symptoms affect the limited benefits? If we're going to, I think I'm hearing that the work rules were an example of what could be, not what is. but if we're going to ask them to stay home for 72 hours plus 10 days till the symptoms are cleared, they've used all of their sick leave in one episode. And so my question is, whatever we do, how aren't we going to have to address that as well? Because we obviously can't expect a staff member to bear the burden of that without our help.
Kind of related to that, Mark, the Emergency Paid Sick Leave Act, or Emergency Paid Sick Leave, entitles any employee that like you're saying, that would be diagnosed or suspected to be having COVID-19. They're entitled to two weeks of paid leave. That's separate from what leave we offer.
Good to know.
And where does that funding come from, Brian? Is that out of the district, or is there some federal program?
I'm not aware of a federal program, Jack, that supports public employers, but I would research that. I would have to research that to tell you that definitively.
I haven't heard anything of that effect, Jack, but it's definitely a piece we can look into. I think what we're trying to do is any of these expenses, we're trying to do the best we can to code them all so that as dollars become available, we can then easily kind of pull what some of our expenses are and see which ones are eligible. But some of these things definitely have made their way through with regards to rights to employees and employee groups, and that's part of what Brian's discussing.
No, I understand that, but I guess it seems like the Senate or they've been talking about funding public entities and so forth, and I haven't seen anything on that lately. I didn't know if you guys had seen anything or if something came through.
The only thing I heard was from our federal lobbyist who works for the Superintendent's Association, and they had mentioned that they felt that many of the efforts around any sort of additional, lack of a better word, stimulus type package that would impact public schools would be something that would come potentially towards the end of June or into July, but they didn't anticipate seeing any dialogue around that till at least that time frame. So we're kind of getting into that time period now, but I haven't heard anything as of late that's detailed any sort of information. I know that there's discussion out there and anticipated that it may come, but I don't know the details.
Do you anticipate any pushback on employees signing this document?
Well, I guess I think, Jack, the best way I could answer that is our employees are certainly members of our community, and we have seen in our community the gambit of perspectives about COVID-19, and so I would definitely be hazarding a guess about whether someone would do that. But what I would say to that is we are, as the employer, we do have the leeway to dictate that an employee has to sign and has to follow a policy if they want to be our employee.
And these are all pieces that in some level we have to have in place in order to start reopening. So when you look at things that are local decisions and requirements, there are certain things, having these policies is a requirement. Some of the language within it probably has some latitude, but we definitely have to have some things that are articulating how we do some of the monitoring, and also the people coming to work who aren't feeling well. That's pretty strongly stated that we need to have a process for that.
I just feel that the second page, especially the part that says if you're exposed but have no symptoms and you have to stay home for 14 days, really would have an impact on our whole institution. Having, you know, how often would a principal have a kid sick at school, come down to the office, maybe he just speaks to him a little bit, and then we can't lose our principals for 14 days, nor any of our staff members for 14 days if they don't have symptoms. So I just, you know, I can agree with the written policy and that first page, but that second page just has too big an impact on sick days, as Mark brought up, and our whole organization.
It could just making sure we're still on. You're speaking when you say second page, the one that's headed work rules for ill employees.
Correct.
Right.
Well, I know that's a big issue, but I know my workplace, if anybody steps foot in our office that has been diagnosed, they are required to shut the whole office down and not go back in. So
what I anticipate,
it's just one of those things where you're trying to protect it. But I agree, it's good. That would be tough, and it's going to be tough because, yeah.
What I anticipate, Joan and Brian, you can correct me if I'm speaking incorrectly here, but I am anticipating if we have a student or an employee that comes down with COVID or there's an exposure at school, I mean, it may not jump into this kind of exam. It is going to be a piece where we have to make a report to public health, and then public health will have will help to determine some of kind of what has to happen with the individual as far as testing and contact tracing and all of those pieces, and then also could make a decision as far as people who had contact with them in school, and could have a decision that impacts the entire school. So, I mean, those are all things that I hope never happen, but they're definitely things that I anticipate that if we had that level of an exposure or an incident at school, it is going to have an impact on certainly our staff, our students, and potentially our building.
Yes, I haven't seen anything recently, Randy, about that, but you know, initially when we were nearing the end of school, they were starting to talk about what would happen or could happen if cases occurred in a school. You know, public health at that time was talking about taking actions or potentially making decisions about whether buildings would, you know, whether there would be periods of closure. I've not seen anything formalized about that, but I am aware due to people that have reported that someone in their family has tested positive. Public health absolutely advises anyone that is tested positive or been in contact with them about what steps they should be taking, which include workplace actions. So I agree that we will be probably given very clear direction from public health, or at least I hope we'll be given very clear direction from public health about what we do if something like that occurs.
So given that reality, do we need either exception to current policy and practice so that if an employee, and I think Joan's case is right on, your office staff, whether it's the office assistants, your counselors, your principals, they come in contact with 600 kids a day. And so how many times a year within this one school year could we be sending someone home for 14 days? And so do we expect them to use their sick leave up, or do we provide a COVID bank that's saying for COVID reasons, we will provide you the bank of days you need to keep you whole without using your other the current benefits. You got a new principal coming in who has 12 sick days or 10 sick days. They could be gone within the first week of school.
Yeah.
And so somehow at least we need to think about what are we going to do about that piece to protect our staff who are risking these encounters repeatedly throughout the year.
We have to remember that for some of our employees, their bank sick days are their only post-retirement benefit. And if they come in contact, I mean, they could delete their whole pool of money that they're anticipating retirement on. I don't feel that this kind of situation should jeopardize a person's intention of when they would retire. You know, someone later in their career could have not accumulated sick days for years because you only got to accumulate 120 and then lately it's been 180. But if you're a loyal, come to work every day employee, you know, you've got that bank after 10 years and you've been with the district 20, 25 years. There's so many years you never accumulated more sick time. And now close to your retirement to deplete that bank just doesn't seem right and doesn't feel right.
Is the concept Joan and Mark are bringing forward something that the board would like us to bring back in some fashion for you to take a look at?
You know, I would challenge that. You know, I understand, but at the end of the day, we're giving them sick time. If you're sick, use your sick time. You know, that's the whole purpose of giving sick time, and we've morphed it into these other things. So, you know, I would challenge that a little bit.
With all due respect, we're putting our staff in a position where we're exposing them to this risk. The other sicknesses happen, within their own families, but we're exposing them to the chance to have this happen by asking them to come in and do their job. And because of that, I think we need to reconsider that thought.
We're exposing them to the flu. You know, we're exposing, every time they go in there, we're exposing them to something.
You're right. And with the flu, you don't stay home for 14 days because you've been exposed. You stay home for
generally a week,
however many days you need if you have the flu.
Yeah.
Dave, can I raise a point of order in that I don't think any of this discussion of benefits is noticed at all, and I'm not prepared to discuss it.
Well, it's a policy that we have been asked to weigh in on.
But there isn't anything about changing additional benefits for staff in our agenda.
I'm asking and suggesting we need to consider the ramifications of this framework. And personally, I would like to see something brought back to us that would address that.
I do think this discussion on this specific policy, even though it impacts benefits because of how the wording is done, it's still a policy item that was noticed. We're not voting on it right now. It's still a draft and it's a discussion. I think it would be helpful in moving forward if a board member wants to see something, a specific alternative, that they should let the administration know. And then when the time comes for actually voting on the policy, people will make their decision. Was there anything else in here, Randy?
I guess I'm just kind of walking through. Are there any of that was our policies that really were addressing some of our staff pieces. There's certainly some guidelines here as well with regards to some of the protective measures that involve students. And then certainly like our self-check process. But we were talking about, like with Dr. Potoff, we've developed kind of our vision for this, just to kind of give you kind of an operationalized piece of it, is that every child would get and I'm thinking of it kind of like the best example is kind of these pink notepads that we have for taking phone messages, something similar to that. I believe we can have them printed in like a group of 100, and then each child would receive those, and then that would be something that they would use as their self-check at home, and then bring them in the morning. And then if a child didn't have one in hand as they came into school, that we would have another process then to help clear them to be in school. That could be something with a a temperature check or some other protocol that we would work on with our nurses. But this is just kind of an example of what some of the other operationalized pieces of this work starts to look like.
The other see that being at the door or in their first class?
That's still to be determined by some of our leadership at the buildings. I would probably see this as something at the door or multiple doors that we would have to have open, because once you get into the classroom, now you have, you're starting to interact more and more globally. So it'd be probably something we're going to need to look at. How can we do that upon entry? We also have some of the other protective measures in here and other policies. Anything that the board has questions about with regards to those?
Yeah, on the protective measures, the face mask in particular, the language frequently says, if possible. Who makes those decisions if possible?
I mean, I think that's a piece that we've had quite a few discussions on, as far as looking at the benefit of the face coverings and also looking at some of the pieces that we know are reality when we're working with kids, as far as them taking them off and then also playing with them. And then certainly the most specific ones we have, and you'll see that written up in the extended school year and some of the camp kindergarten pieces, is there are certainly students that have sensory issues or other disability type related impacts that wearing a face covering is just not going to be possible or practical.
And Randy,
So, yeah.
the student one, I don't have as big a problem as the staff one. The staff one has a lot of language, if possible, the district may require. I just feel we're not really giving a lot of guidance. We're leaving a lot of leeway in there. And I guess my question is, you know, like at Bethel Circle, who decides which employees out there wear a face mask, how often they wear one? Who is the deciding person on the, if possible, for staff? Right.
Now, Brian, I know you worked on some of these policies. I mean, I think those are all pieces that we have to put specifically in place as you're looking at, you know, we've talked about Bethel Circle and some of the pieces as far as where people work. And the whole issue of, are you working in your office alone, or are you in a meeting with other people, and can you maintain social distancing? And we have to have some of those protocols in place, just like a school is going to need them for their students and their staff that work in a school environment. You start to look at Bethel Circle, we're going to have similar pieces put in place out there as well. Brian, do you have additional thoughts to add?
This particular policy, I believe it was John worked on this one.
Oh,
no, it was actually me.
Sorry.
That's okay.
Sorry.
Nobody wants to claim it.
I'll claim it. So the thought behind some of those if possibles, and again, there is a degree of situationality involved in some of these things. And when Randy and I had conversations, the conversation we had with Dr. Potoff, we asked him some questions about, for example, if you're working in your office alone, do you in the medical arena require staff to have their masks on? And they don't. It's when they would leave their office and go to like a common area, like we'll use Bethel Circle. If people are going out to the copy machine to retrieve something that they printed or something that they've copied, they would be expected to wear their mask out to that area to retrieve whatever it is and to go back into their office, and then they wouldn't have to wear it again. The other part that this references, and it's both the student side and the employee side, you'll see the asterisk on a couple of those items, and then it goes down to employees with medical conditions that interfere with wearing a face covering will be exempt from wearing one. We have the same for students as well. Some of our students will also have a medical condition that will interfere with the wearing of a face mask. And that's broader than the sensory component that Randy talked about. There are actually some medical conditions, asthma being one of them, where it can trigger, wearing a mask can trigger some of those medical conditions. So we would have to, and again, we've got to work with Brian on this, to get information that would create that exemption. We also would, this is kind of combining the student with the staff working with students piece. If a student isn't able to wear a mask, we would actually provide those employees with additional PPE to provide them with additional protections. So that's where we would look at some type of eye protection, whether it's face shields or something in addition to just the mask that they would wear. So that's the kind of balancing that we're trying to do with both of these protective measures components, is balancing some medical conditions where face coverings can't be worn with trying to keep the risk as low as we possibly can. I don't know if
Kurt,
that helps
when you talk about medical conditions, will you require some type of documentation that says that this person has a medical exemption, per se?
On the staff side, I'm going to actually defer to Brian on that one. On the student side, we would, yes. So Brian, you want to tackle the staff piece?
Yeah, so what, I guess to kind of put together what both Randy and Kurt had said, part of what we will need to do as the employer is we'll first send out to all employees a plan for return. Within that plan for the return, that'll include all this information that we're starting to discuss at this point, what expectations we'll have for them, what work conditions they can expect. And then along with that communication, we also need to say, here's who you need to reach out to if you have questions, or if you need to, you have requests for workplace flexibility or workplace accommodations or any other concerns. And that typically is going to, that point of contact is going to be typically the HR office. And if we're talking about accommodations, Jack, which would relate to ADA or the Disabilities Act, that does require you to get documentation. If we're talking about workplace flexibility, which is not necessarily something related to a disability or defined disability, then you get into different. You're not required to get documentation for that. But if it indeed isn't an official accommodation, which is a legal action as part of ADA, your best practice is to get something from a doctor or medical provider.
And does this fall under ADA?
It could.
Okay.
It could. It absolutely. It could. Kind of. For example, if we were to use what Kurt's he talked about asthma and masks. That is definitely a situation right there. It's a chronic medical condition that could very likely apply to ADA. That's just one example.
When do you anticipate getting this out to staff so that they start preparing?
Well, that I think is probably, it's a subject for later in the meeting too, Randy, and you can stop me if I'm wrong. I think we really see a couple phases with this. There's certainly the idea that's going to come up for discussion about when do we start to reopen main offices of buildings. I would see this part of this communication and this process being it has to be a part of that. I think there's also the on-site work with summer school that's going to require some of this, and then ultimately there is anything that's going to become on-site as we go into the fall.
So some of the things that I see there, Jack, is as we look at these implementation policies and procedures, what I would like the board to consider is kind of an initial view of them and a endorsement to move them forward for returning staff in early July and for the programs that we're bringing back in July. I think then there should be also a parallel piece coming where we do a full review of some of these things for our final decisions that will then yield us for the fall. So kind of getting into all the different, it'll give us an opportunity to start to implement these and then tweak them as we see some areas that we need to make some modifications. It'll also give the board a chance to kind of vet some of these things over the next 6 weeks or so before to kind of see how they work and then finalize things before they roll into the fall. But we do need to get some of those, I call it a survey or an interaction with our staff to gain this knowledge to really see where our level of exposure falls with regards to needing to make accommodations, and then doing that in accordance of following through per the protocols that we set in place.
I guess I'd like to say one more thing about the policy. Do you feel that an employee, when they read this policy, would know exactly when they should wear a mask and when they don't need to? That when they sit in their office alone, they don't need to. So let's think of the high school office. You have people who are not in an enclosed office, but they're sitting at a desk 6 feet away from other people. Do they wear one or don't they wear one? You know, the language to me seems not very specific or decisive of when you do and when you don't. And it seems like there's a lot of gray area. If possible, you wear it to the restroom. Well, why wouldn't you wear it to the restroom if you're in a hallway where you could meet somebody? I think we need to say, yeah, put a mask on if you can wear one. I understand the medical conditions. I personally think the policy is too vague and it's not giving people definitive assurance that they're going to meet people with masks when they leave their office, and in their office they don't have to be one. And then in those general kind of desk areas where they're distanced but not enclosed, is that considered okay to take it off or not? I would like it more concrete than what it is.
Randy, normally a policy item would go through the policy committee. I'm suspecting here that what you're doing is this is kind of the introduction with the idea that we're going to have to vote on this probably at the next meeting.
Right. I mean, I think what you're looking at here is, I mean, these are all pieces that are policies for reopening required under the forward game plan. So they're not necessarily going to be policy book items. They'll certainly have the effect of the implementation of that. I think certainly these are pieces that we need to bring back for some final revisions based on some input here. It's also kind of an awkward piece in that as we have staff in buildings, we still have to start implementing some of these pieces. So some of them get implemented on the fly here as we are starting to have staff in buildings, and what are we going to be putting forth as, and particularly as Brian was talking about, I'm just going to jump ahead here for a second. It's returning, it's kind of reopening our offices. We have a lot of people right now who are working remotely in our school offices. Bethel Circle has some that are working remotely and some essential employees who are working in the offices. But certainly we need to start bringing pieces back to school, particularly if we're going to start bringing some of our students and our staff activities back, even at a measured rate in July. So when we look at our board meeting on the 13th, according to what Brian is trying to kind of work through here, is potentially bringing folks back on July 6th. So part of what I think we're looking for is some guidance here tonight on how, on the policies. If you're asking for some more specificity, I'd ask one question here to Brian, is as you look at some of these staff pieces particularly, do you see the policy being your kind of general overarching policy, and then there being specific kind of implementation rules that are written for each building and office? Or do you see the policy in and of itself kind of operating in its effect as it's written? And if the board wants more specificity, that this is the place where it needs to go?
Well, I guess part of it is at least in my experience with the policies of the board, they tend to be more general. And then certainly we have procedures that get more specific, as you go. And I guess I would see often kind of the same process with these, but certainly we will, we'll do whatever the board thinks needs to be done. And so ultimately, yes, I do think, Joan, what you're talking about is some of that more detailed information. I do think that comes to employees as kind of procedures, office procedures. I hadn't thought of them as policies, but again, I'll also say I did not write all the policies. So, and so we I think we all probably had some.
I think one of the things you guys did a good job. It's a great start. But I think as you put these things together, this is going to be a specific time or specific period in time, probably the next year, maybe the next 2 years, that these things will probably go away. And I think what you probably want to do is err on the safety, the most safe. And as we get more science and our medical folks have a better understanding of what's happening, we can then relax some of the things that we put into these documents, because it seems like some of this is boilerplate. You're getting it from CDC or public health, and they're kind of dictating what has to be in there, or at least a framework of what has to be in there, and you're dressing it to meet our needs.
Right. I think that's accurate.
So I think you err on the side of safety. I agree with Joan. If you're sitting in your office, you got your door closed, you probably shouldn't have to wear your mask. But if you're in public areas, the example of you're sitting out in a public area where people could walk by, then you have a mask on.
Does it seem, I liked Kurt's explanation of some of the wording, but it would seem to make more sense to actually put the explanation in the wording rather than getting people to make assumptions. I think we've seen enough of the assumptions in bar openings around Wisconsin that I think if we don't get very specific, we're going to get a huge cross section of how people are going to react. So when I was looking at both of them, when it says, wear face coverings when possible, and then has the asterisk makes a lot of sense. But why not just say, shall wear face coverings when more than 2 people are present, and then the asterisk explains the medical condition, and you're done. Now you don't have to try and guess when and where you shouldn't, or have different building administrators feeling one way or another on a more vague wording.
I think what we can do is go back and kind of add some of that specificity as Jack and others have articulated here. I guess one of the questions I have is if we're trying to, is the board comfortable kind of, and I hear what you're saying with regards to the specificity, if we're trying to bring back some of our office staff, now this isn't obvious, the bulk of our staff come back in the fall, but when you start looking at trying to bring programs back into buildings and some of the things we're looking at for our camp kindergarten, et cetera, we'd like to have some, bringing some of these functions back in the building offices and in Bethel Circle probably sooner than we have before the July 13th board meeting. Is the board comfortable with us working on the specificity of this and simultaneously also implementing some of this as we're starting to transition our staff back, realizing that as things kind of ebb and flow, we may need to adjust things accordingly. What is the board's?
I think you gotta, in my mind, what you have to do is take the best information that you've got from CDC, public health. They've given you some guidelines, they've given you some directions. This is what you have to do. Be more specific in areas that Joan and Dave have brought up, and implement them, because this is, as we've gone through this whole thing, it's been fluid. It has changed. So I think if you want to bring these people back by July 6th, you're going to have to implement and make things happen.
Right. And that's my question, Jack, is the board meeting doesn't come to the 13th. So if you're comfortable with us kind of implementing the more specificity as you're articulating here, then we can continue to move forward, bringing people back on the 6th, and we'll bring the more specifically articulated policies on the 13th.
Randy, my concern was more for the employees, that they feel some assurance that they're going to be safe. And I think, wearing a face covering when they're in a small space or in an area that is more utilized by multiple people, I think our employees need to be sure that that is the protocol. And I think there's just too much when possible in the writing, but I fully trust that, the procedure and the implementation, I think we all have the same ideas. Okay. And I just think that, we need to word it so that the employees know what the expectation is.
All right, very good. If the board's comfortable with that, I'm comfortable with really the direction you've given me, because what we'll do is we'll work on kind of the spirit of what you're implementing here or sharing with us, updating our policy to be more specific with regards to that. And then we're also going to be utilizing that more specific language as we start to bring some of our staff back. And then we'll bring the final draft or the next revision of that policy back to you on the 13th. Does that seem fair to everybody?
That sounds good. This is a small detail, I guess, but somewhere in the process, I think we also need to provide staff and families some best practices with the face mask. I mean, how many face masks should a teacher have with them in a given day or a given week? Is what the same? Can you wear the same mask repeatedly? And if you do, does it have as much? Does it have an effect on your health? I think I was reading some of the letters for the board tonight, and those are some of the concerns of people concerned about mandating face masks. Somewhere along the process, I'd like to encourage that we at least address best practice when using them if we're going to mandate them.
Okay. All right.
Like I say, err on safety at this point.
I guess, Dave, my question would be for the board. Is the board comfortable with us moving ahead with obviously the more specific pieces here specifically for staff? And then as we start to put forth our planning to utilize these policies as kind of the base for all the work that we're doing, as we're bringing staff back, and then certainly as we're bringing some of our student programs back towards the latter part of July. And then we'll bring the policies revised per the feedback we had here tonight and bringing that to the board on the 13th of July.
So far, it seems like I've heard everybody say that, yes, they're okay with it. Is there anybody who would disagree with that?
I wouldn't disagree. I guess I would just like to be expressly stating that I think that the directives on a lot of these things need to come straight to the board, and that we are responsible for that, and that it is not something that you even necessarily need to say, well, this is just the way I've decided to do it. The buck doesn't necessarily have to stop with you on everything. I think it's supposed to stop with the decision makers on this. So if you need to tell people, bring it to the board, please tell them to do so.
All right. Well, thank you, Mike. I appreciate that. I guess the pieces I just want to make sure is that we can keep our planning and our work moving forward, certainly respecting the board's process here and wanting to have the weighing in of that. I mean, even if you want to make a motion that we can continue to process through these and implement them, and then bringing back the next iteration of draft policies at the July meeting, that would certainly meet the spirit of, I think, what you're talking about too, Mike.
So I
I'll
would,
make that motion.
could I suggest, I would like to see an amendment to that motion though, is that whatever policies you do in the interim, Randy, that you send it out to the board right away.
Sure.
So that if we see something that we want to bring up next meeting, we could get that done faster.
Absolutely. And I think generally what you're going to see is the ones that are in front of you here. And then also the ones that we would be modifying, particularly based on the feedback, is adding some more of the specificity to the staff. I think that's what I've heard this evening.
Yeah, I actually thought your ones for Camp Kindergarten and the summer school were very clean cut.
All right.
The language was very straightforward.
Yep. Yeah, and
so there is a motion on the floor. Is there a second?
Second.
Second by Mark. Any further discussion? All those in favor say aye.
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 All those opposed say no. And there you go.
All right. Thank you very much. And I think you can see as we start to walk through these, just the complexity of all the pieces that are going into this. These policies serve as a backbone of all of our planning, and you'll see that as we move forward. So the Camp Kindergarten ESY, I'm not going to spend a whole lot of time on, other than just articulating a couple things here. Certainly this was a piece that we have had discussed at our June 8th board meeting, really starting to continue to move forward with the July 20th and the 27th as our Camp Kindergarten dates, and then looking to work with our extended school year as we're able to in the month of July with those are very small groups, potentially even one-on-one. You can see one of the pieces that I've articulated here with regards to the face coverings is some of these kids just aren't going to be able to do that in ESY. So that's a piece that I've articulated here as something we needed to be able to put in some other personal protective measures to help keep our staff safe in that consideration. But we also know that in some of these situations, I needed to make a little bit of a deviation from where we were. The policies are the ones that you've already articulated. Those need to be in place, just as you approved for us to do any programming. And then the last part with the Camp Kindergarten and ESY was really the survey piece. I think the part, just to summarize, we had 170 some individuals who returned the survey. About 80% said that they would be sending their children under the conditions that we outlined. 20% said they wouldn't. And then of that 20%, I think part of that was delineated between just not comfortable sending their children to school yet, and then another portion being with a concern specifically more about face coverings. So I think that's just my very, very high level overview of that. So any questions about the Camp Kindergarten or ESY aspects or the survey that came forward?
Randy, were you going to talk a little bit about the transportation ESY piece that we had talked about this afternoon?
Was that with regards to transition?
The transition program. I kind of, okay, you got that as a separate, okay.
Yeah, all right. I'll grab that one next. I'm just going to kind of chunk this as something we've already approved. Any question just specifically on the Camp K or the extended school year piece?
So Randy, with what we heard Dr. Pothoff say tonight,
yep.
I'm in agreement that we try the face covering. It's a short period of time. It's a good, trial to see if it works. But just because we're requiring it for Camp Kindergarten, we're not making the decision for reopening in fall.
No, I'm trying to chunk some of these decisions as, so what you're seeing in front of you is the Camp Kindergarten piece. And so this is not a decision for the fall. That's a piece that's yet to come. So I think that's a great clarification because I think that's exactly what we're doing.
And it
so
is.
Right now we do have that as a requirement, and we also realize that just as Dr. Pothoff shared, and as I know I've had some parents articulate to me, it's a piece for us to kind of see how that's going to work with some of our youngest learners. And certainly we're going to have to work accordingly with that. And I think that'll provide us at least some feedback experientially from our staff too.
Perfect.
Okay. Everybody comfortable? I don't need any motions here other than just to kind of bring this forward and see if there's any further questions. All right. Hearing none, I'm going to move to the next piece. One of the things that I feel is important, particularly as we got past the June 8th meeting, looking at Camp Kindergarten and extended school year, I also wanted to start seeing what are all of the activities that we have happening within our schools. I mean, quite frankly, this is a relatively extensive list. I tried to chunk some of the things together. What I'm really looking at here is wanting to try a few more areas in July, particularly now that we're in phase 2 of the Forward Dane plan. Also seeing some of the guidelines that have come out with the second phasing, and also looking at some of the guidelines we have from WIAA. And the areas that I'd like to have your consideration on, one is what Kurt brought up. This is our transition students. Our transition students are 18 to 21-year-olds. And part of their experience and part of their program is working in job settings. So to the degree that those students and their families decide that that's a place where they want to be, transportation can be an issue for some of them to experience their program. And a work experience isn't something we're able to replicate. So what we would like to be able to do is utilize our school vans and our staff who are assigned to working with these kids. And it would basically be almost one-on-one, just transportation to and from their job site. So I see Kurt's nodding his head, and I just wanted to give him a second just to articulate kind of what the scope of that is. But I believe we're talking like 4 students. Is that correct, Kurt?
Yeah, what we would be doing is we have more than 4 special ed vans, but we'd be utilizing 4 special education vans. A staff member would be assigned to the van. They're all numbered. A staff member would be assigned to a van, and a student would be assigned to the van. So the staff member and the student and the van would all stay constant. And they would shuttle the student, they'd pick the student up at their house, take them directly to the job site, provide the job support, job coaching that is in the IEP basically. And then when the shift is over for the student, they would take the student directly to their home. And then they would also clean according to the guidelines that public health has put together for the use of transporting students in minivans. They would also wear PPE. The student and the driver would wear PPE. And that's kind of the extent of that program. They would not be coming into the school building at all. They wouldn't even be coming to school. It's a direct transport from home to work and work to home when the shift is over. When we first closed in March, the families, the parents were doing the transporting, which wasn't difficult because the parents, many of them were not working or their schedules were flexible enough. But now that the economy is starting to open up, some of the parents are having to return to work, so that transportation piece is becoming a challenge, and we don't want the students to be losing the jobs that they have secured to this point, because these are the jobs that they'll maintain when they age out of our program at age 21.
Yeah, so I think that's an important distinction here. These are jobs on site, paid positions, jobs that these kids hold, and then something that they would continue once they leave our care. So, I mean, this is something that I think is reasonable for us to at least consider. The other areas I just wanted to bring up to you for July, as we kind of vetted through these, is professional development. We start to bring back different pieces with our staff, some of which are small enough group sizes that there's opportunities to bring some people back in person, if that's a decision that we choose to move forward with. We also have some students that have either pathways evaluations, transferring students who are transferring in, homeschooling students. I also know that there are a few kids that we need to address with regards to ACT makeup still, or makeup tests, or some ACT related work that we would like to bring forward, and then also special education evaluations. Those aspects involving kids is very much very personal, very small group, or very much one-on-one. So that would be a piece I'd like consideration of. And then as we take a look at, we've already done approved extended school year camp kindergarten, transition students we just talked about. There's an ACT preparation class that runs both sessions of summer school. The first session there, the instructor is committed and has the plans in place to do that virtually. But for the second session of the ACT prep class, he would, if possible, like to see if he can do that in person. And that would be a piece that I think would give us an opportunity to work with the kids and start to look at some of the classroom environment at a different site. And then the other pieces that I'm looking at are with regards to, I'm losing why it's not on here, ACT prep, the weight training class, band camp, and the gridiron camp. And those are pieces that I think would give us some experiences in different parts of our organization. They would start to help us utilize some of our outdoor activities. It would utilize some of our weight room, which would be in parallel with some of the work that would be some of the rules we'd follow that are related to
Randy, how do you choose the gridiron camp as kind of your trial, but baseball youth camp and volleyball camp and girls basketball? How do you differentiate between?
Yeah, in this case, I chose things that were really high school. So you'll see these are all youth camps. They also had the ability, when you look at the forward-ordained plan for sports, involve kids that are, your maximum group is 15, whereas I can do larger groups with older kids. And some of these, so that was part of it. Some of these groups opted out, so I didn't necessarily cancel all of them. Some of them canceled themselves. But you're seeing really high school camps here is what I'm looking at. So the band,
I understand.
I'd like to see how can we do band. I mean, that's certainly a piece that we're going to have to figure out. Doing some of the things with the band camp, which potentially has some outdoor activities to it, may be possible. Gridiron camp, there's certainly that's a football camp for our high school kids. It's not football as usual because we have to maintain some of the social distancing pieces, but I think it gets our kids active. It's a large group, and they have a plan to kind of rotate people through, from my understanding, and also it doesn't include some of their traditional workouts that they would have where there's contact, etc. That's not going to be allowed for where we're at in the plans, and some of their classroom work they'll do through Zoom meetings. And then the weight training piece, that's going to be basically keeping our numbers down and rotating kids through. Weight training right now is happening in summer school on a virtual basis. So this could be a piece that some kids opt into towards the end of July, or they could continue to do it virtually. So that one's got some flexibility to it. But those are the items that I have in front of me that, as we've kind of vetted through, I'd like to give an opportunity to do in July. And this is a piece I would ask for your support of this evening.
So, Randy, question on the weight training. Do you have to be signed up for football to be in weight training?
No, that's actually a summer school class. It's open to anybody.
Okay, so it's open to.
Yep.
Okay.
Yep, that's one that's open to anybody. I know Sheila's on the call. The weight training piece, certainly, it's heavily weighted towards a lot of our kids who are involved in athletics, but it's certainly not limited to those kids. And it's certainly it's boys and girls, so it's both, and it's part of actually our summer school program. And this is a piece I just think that it would be get our kids active. It's got quite a large participation, and if we're able to do some things in small groups, it gives us an opportunity to do that and try that piece out.
Randy, what would be the limitation for weight training if they do it inside in the weight room?
You're looking at probably 15 kids, probably 15. You'd have to do pretty small groups. That'd be a piece. What I want to do with any of these is I want the person who's organizing it to have to put together a written plan, as opposed to me just saying, yeah, this is okay. I'd like your approval tonight to move ahead with this, but I'd like us to have a piece where there has to be a written plan put together. And I've just articulated Steve, Brian, Kurt, John, Tim, and I to kind of serve as a vetting group to who know these policies that we have in place, know the guidelines that we have with regards to WIAA. There's some guidelines for how you can run a band instruction environment, and make sure that we have the protocols in place that we're comfortable with. That deals with the group sizing, the rotational pieces, the cleaning aspects. If for any reason we can't meet our expectations or it can't happen, then it doesn't get approved. But I'd like some opportunity to start looking at how we can start to apply these policies into some really high desirable areas that are going to get some kids active, gain us some experience in the process as well. And all of these things are starting to lead up into things for the fall. Starting in the very beginning of August, you can see what starts to happen as we get into, there's volleyball camps for our high school students, and here's where all the athletic practices come. So there is still a decision that has to be made on competitions, but practicing in all of these has some abilities to occur with limitations. And I'd like to see how we can kind of learn from that with some of the camps that are already slated to occur potentially in July, and see if we can support them. Any questions about that?
When will these changes in sort of how they're going to deal with weight rooms and stuff be put out there? Because I used to be in charge of many weight rooms and fitness centers over the years, and I know if MRSA broke out among our athletes, things were shut down pretty quickly. And I know that the amount of care it takes to clean things
right,
very detailed. So,
and I think the piece that I would answer that, Brian, is I would open it up to the folks who are organizing these. Certainly some of them are motivated to want to try to get their programs going. And they're going to have to meet the requirements to put together a detailed plan that addresses that. And if there are issues, it will stop. And that's going to be, and it's also going to looking at logistically, is it going to work for us? So there's absolutely going to have to be some pieces put in place. I think what we're looking at, particularly with regards to weight training, there's a few other districts who are starting to take a look at that, and also seeing how can you, and I think they're kind of looking at, instead of, I'm looking at high school students, some other communities are looking at more of their youth pieces. It really falls into the same piece. All the policies that we had before apply to this. There has to be a wellness check coming in. There have to be protocols for cleaning. There's like, you're not using the water fountain, you bring in your own water bottle, you have your own, there's certain protocols that are going to have to be very personalized in order to make some of these things work. And that would all have to be vetted through our committee.
So do you need a motion on this, Randy, or what do you need?
I would like a motion, because I think that expands some of the pieces that we've requested. So I would like a motion, Jack, that just gives us the direction and ability to take a look at these. I guess I would also, if there's something else that comes up that's related that we think that we can and should fit in, that we have the ability to at least vet that. The piece I don't want to do is start opening it up where it's a snowball and I can't keep up with all of the volume of it. But I mean, some of these things, for example, the transition students piece, some kids who needed some ACT testing, some of those have come up just through as we've continued to kind of vet these things out. So I would like
quick question there on the transition. Those students, those students that when our schools are open,
right?
Do we supply transportation for those activities?
Yes, we do.
Yep.
Okay.
Yep. These are all kids with IEPs that are in that program, and then there's things articulated through there.
Okay. Well, I make the motion to start opening programs as identified in your memo to the board.
Second.
There's
With
a second
erring
by
on safety.
Joan. So, motion by Jack, a second by Joan. Is there further discussion?
Yeah, I have one question, I guess.
Oh, Mike?
Go ahead, Brian.
Before weight training and all that stuff starts, are those policies going to be run through the board before those begin in the end of July at our next COVID meeting?
Yeah, I can run those through if that's something the board would like to see. What I would do, what they're going to be is they're going to be plans that would have to be written that would be in line with our policies. So if there's some things that you'd like to see what those look like more specifically, we can bring those here. I guess my intention, Brian, was to utilize our policies as the backdrop for us administratively to try to work through them to see if they've met our protocol so that they can get moving with their planning.
No, I trust you. I just didn't know if some of that stuff that was going to start in July, later July, was going to come back out through us. But
I think if there's something that I see that's going to jump out at me that I think I need to bring to your attention, I would. I mean, I think some of the things that when you get into, obviously band, you can't have a face covering on when you're playing an instrument. Some of the things that have physical exertion, there's going to be social distancing pieces, and some of the face mask pieces aren't part of that. But definitely if you're in an instructionary mode or in something that's not where you're not exerting yourself, then there's going to be those requirements. So those are kind of the things that kind of ebb and flow through there. But my plan was not to bring those written plans back to the board, but for the board to kind of delegate that off to administration to implement the policies.
Any further questions or discussion?
Yeah, I guess the question I'd have is, I mean, I really appreciate saying that we need to have policies and rules in place for things, but maybe I'm just being cynical, but I'd like to think it's a little more realistic, and that we already have people not following the rules. There's kids that all playing football on the field right now, and people reporting it constantly. So we can have all the great intentions in the world, but I think there's kids in my neighborhood not distancing. There's already kids, high school kids, who I can see on the field out there, and I have to think we or people in the district know that they're there, and that has an optic that perpetuates in the district, and I'm concerned about it. And there's an optic here of the things we're picking to go ahead, and then the things not going ahead. So,
right.
I read those WIA policies, and it does specifically require like an administrator, not a coach, be in charge of checking that these things are actually being done. I really hope we do that, and that's all I'd say.
No, I concur with you, Mike. I think that, I mean, from my comfort level, it took me a while to get here. I'll be very honest. I was starting off with camp kindergarten and ESY and really calling that where I wanted to stop. As I started to really start to look at this and really put together what was coming for us in August, and also realizing, and part of this is, these are some activities that have some high activities in. A lot of kids are involved with them. To give the kids, to a mass of kids, an opportunity to do some things under a structured environment, as opposed to them creating them on their own, I think has some positive impacts too. So, but yes, I completely.
I think one of the things. Yeah, I think one of the things, just the experience with the cross country group, those people, those kids are really taking the social distancing pretty good. There's a couple kids that are a little closer when they're talking, but when they're on the runs, they're 6 feet apart.
Mike,
So I think there's different groups.
Mike, I would agree with what you're saying about the kids practicing. Part of it, as an educational-based athletics, we haven't had a chance to educate our kids on why these things are important. So it's an opportunity for us to really start educating really what is a set of leaders in the high school, not just the athletes, but the band kids, the ACT kids, to get them prepared for what might look like when we're in sort of the school year. And this is a good training ground for them, but it's also a good opportunity for our coaches and us as administrators to educate those kids on why these social distancing steps and these PPE steps are so important to mitigate the spread of the coronavirus. So. So I just wanted to add that in there.
So we have a motion. Are there any other questions or comments? All those in favor say aye.
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 All those opposed say no. And the motion passes. So next, Randy, is...
So I think we already did the return to the office. Is there anything else you needed there, Brian? Oh, we were going to talk a little bit about the app that we were going to utilize for staff. So you saw on the previous slides that we, in our policies, that we would have a tear-off paper sheet for our students for wellness checks. One of the things that Brian is looking at for our 600 staff is a web-based app that they can do their wellness check with. So Brian, do you want to take just a moment to explain what that process is and what your research is on that area?
Sure. What I've found is that right now we have there's really three web-based applications, and they're not apps per se. They're websites, accessible websites. So that in that way they can be accessed by a regular home computer, portable, electronics, or mobile phones, depending on what someone has available to them. One is from a company which we already use called Qualtrics for our surveying tool. They've partnered with a company that specializes in medical information, and another is a separate entity called Health Check 360, and a third is one that we don't have access to as we're not clients of M3 Insurance. But they all work similarly. The employee goes in, is prompted via the system to, again, enter answers to a number of questions. What symptoms are you or are you not experiencing? Who have you been around someone who is experiencing or been diagnosed with COVID-19? Have you traveled to an area that puts you at high risk? And then it asks you to ask the employee to enter their temperature. Based on their responses to these questions, they're given an actual green light or a red light. Green light is you're clear to come to work. Red light, you should not come to work, or you need to contact someone else in order to be permitted to come to work. And all of this information is then live updated to typically two, or all of them have at least two spots that you can report it to. It would go to direct supervisor so that they would know which of their reports are going to be coming into work or not able to come to work or have not completed this yet to be able to come to work. And then it's going to go to the HR office as a place for us to hold and house this information in terms of how they answered the questions, because this is, again, a medical record that we would need to maintain following the appropriate laws and privacy in those rules. The supervisor themselves only gets here's who can come to work, here's who can't, and here's who needs to do something in order to come to work. In discussions, we just thought that, one, having it be our employees, we can ask them to take this step. There's a lot of opportunities for them to personalize when they get their alerts, how their alerts come in. And then that would give us a very manageable way for us to know who can come in, who's coming, who's not. And on top of it, it gives us a real legitimate tool for tracking purposes. Knowing who is with whom and who's been in contact with someone else. It could be a really valuable tool for if we had to track an outbreak, for example. In kind of reviewing the information, the one that we felt most comfortable with actually happens to be the more affordable of the two. Our partnership with Qualtrics has gone very well. We feel that they provide a great deal of customer service, technological support. It happens that their what they're offering, or the cost for them to offer this to us, to our employee group of about approximately 600 employees, is the more reasonable of the two opportunities, or two they weren't quotes, but I guess they were kind of de facto quotes. And so that was the one that we're leaning towards using, as we just feel it's a good, very good option. Any other questions, I guess, or things that you wanted me to cover, Randy, that I didn't?
So you're looking at.
Go ahead, Jack.
No, go ahead, Brian.
I was just looking. Is the price just for annually then?
Yes, that's a 12 month expense.
What is the implementation fee? If we have multiple options, what do you, is that could go up or down? What are they doing from an implementation fee if we're already using these guys for something?
Well, part of this is what basically we're going to have to provide the employee contact information, employee groups. We need to provide to them how it will roll out. Which groups are going to be drawn into this at which times. That's why the more detailed, it doesn't go into a more detail, because part of it is that plan really remains to be developed about which employee groups are going to be brought in at what time. I'm sorry, the one thing I'd add is that this is really it is a company that we work with. This is an add-on product that we've not had any work with them on.
I can think of it just as a modular to the work that they provide for us. I mean, they provide the Qualtrics platform, which we can build from, and then this would be a specified project under that. One of the things we thought was that an electronic version for staff was more manageable for our supervisors to be able to manage than trying to track down paper slips from our employees as they're arriving and coming to work. That way it's pretty much automatic, and we can then check it to make sure that everybody is adhering to it. And then the paper piece we would keep just to our students. There's also, we looked at the electronic piece for all of our students and staff, and it just found that to be cost prohibitive.
So this is, for lack of a better term, an app that we'd be paying, I'm looking approximately $13,000 for?
Yeah, this is basically an online process for them to do the daily checks with all 600 of our employees, having a place where they can log in, enter their information. And then I believe that there would be a report that would go to their supervisor and also to HR to keep the accountability piece in place.
Do we have any
for something electronically to utilize? And this was one of the options we're taking a look at.
Do we have any input from staff or WTA about how they feel about this?
We haven't got to that point, Mike. We do have a meeting with WTA tomorrow I'm sure many of the conversations we're having here tonight will be part of that dialogue.
Randy, is Infinite Campus doing any of this as well, or?
Yeah, I know, Tim, you're on the call here from Infinite Campus perspective. I mean, there's certainly some things I think that Infinite Campus provides. I haven't seen anything that provides it. Infinite Campus is really our student management system. It doesn't provide the pieces for our staff. I don't know, Tim, if you had anything to add there, but I think the best models out there are the ones that Brian was looking at electronically.
Yeah, Randy, as far as I've been able to follow the development pipeline, most of the rapid feature development that's going on right now for Infinite Campus is more on the student side, in particular, master schedule. There are going to be a lot of complexities with our master schedules this year, and that's the primary area of development I've been following with IC. I don't think they have new capabilities in their rapid pipeline related to this, Jack. Not right now.
I hadn't seen anything.
Thank you.
There, so.
Thank you.
Very good. Yep. So this is a piece we're going to continue to progress down, and so we'll, I think your piece, Mike, just to assure you that it'll be a piece we'll talk about with our WTA leadership, along with some of the policy implications that impact staff. Okay. Any other questions on this item? All right.
Do we need to vote on this now or get this now, or can that wait until we have more input?
I guess my question is, does the board feel like you want to weigh into this piece? I mean, it's within a dollar amount that doesn't need board approval. Is this a piece that the board feels like you would like to weigh in on as we start putting our planning parts together?
Anyone have a strong opinion?
I think you should go to the WTA first and get their feelings about it. If you feel you need it from a administrative standpoint, I think, you know, we'll support that, but it doesn't seem like it's, you know, fully ready to jump on.
No, I mean, there's no, it's not something we're probably going to have in place for right in the beginning in July. And we'll have some other protocols to be able to deal with, but it's certainly something we'd like us to have in place as we start to hit the fall. So it can be a piece. What we can do.
The one thing I would add, though, is that we have to either be checking our employees when they come in, or they have to be self-certifying. And so whether they, I guess what I would say is certainly important to talk to employees about this, but one way or the other, we either have to check them on the way in, or they're going to have to use this web-based application or give us a check-in sheet. That part is not something that we have discretion on. We have to do that. And so the reason for the use of a mobile app is more for or the web-based app is more for management and centralizing the data. It is that the part that's discretionary is how we get that data. It's got to come in one way or the other.
Right. Agreed.
I think you really need something that's electronic, that comes in easy, because it's going to take you manpower to collect all this stuff. Then you're going to have data entry. You know, somehow you got to speed this process up.
Right.
Then it sounds like people are generally good with it. Randy, with you conferring with the WTA.
All right. So we'll confer with them in our meeting tomorrow, and then if and we'll talk through this. And generally, if that is a generally accepted process, we'll move forward. All right. I'm going to move. Right now, we're going to shift over to really fall planning. And what I've added into what I put up on the screen in front of you is really the rough draft and kind of the place where we're starting to populate what I call just our Waunakee Community School District reopening framework. Starts to articulate our story, starting back of us being closed on March 13th. You saw the guiding principles for reopening that you agreed upon and you endorsed at our last meeting. And then what I've done is I started to really populate what I look at as categories of work. If you've taken a look at the Forward Wisconsin plan that came out today from DPI, it has different categories of reopening. And generally these are the main headings, a general description of what that work entails, and then I've assigned a point person you can see in the right-hand column. This work is important because we need a place to kind of hold the documents, the plans that are being in place. So we have one central location to do that. So what you will see is an ability to then link in through some of these documents to be able to get to the work that's being transpired by their groups. There's going to be a couple different levels of governance here, certainly the board being an important piece of that. But from an administrative standpoint, there's going to be two different aspects. There's certainly the work of the people who are operating as the point people for this work on each of those categories of operations, and their need to really start to define what the work is, some of the key questions, a key piece is who do you have to coordinate with, who do you have to collaborate with, and making sure that we're tight on some of those teams to have feedback and to provide a framework that can then be utilized by our building leadership teams, which will be consisted of our building principals and staff from their buildings. I've also asked for them to create a place where we can have some parent communication that happens through a parent liaison to those groups as well. And this is where you start to operationalize that. There's certainly things that are going to be the same throughout. So for example, if we have a wellness check process, we're going to decide that at a level from a policy standpoint at the board, and also from a general category and general process standpoint from more of a district level team. But then it has to get operationalized as far as how do they implement that. So I think, Brian, one of your questions is are you going to pick up wellness tickets at the classroom or at the front door? Well, it's most likely not going to be the classroom, but it might be multiple doors. So that might be something that gets operationalized at a leadership team piece. But this is a piece that our buildings are just in the process of starting to put together. From there, then they will be developing links to this plan that will be articulated for each one of their schools. You can see the high school has started to populate theirs with their folders. The information that's coming here will then be a place that we can all access, and also be a piece that will then serve as really the framework for our reopening planning. The one piece that I thought that is definitely in a work in progress, but it's starting to put together really a timeline. When you start to back yourself up from where we are in September and starting our first days of school, we have the items in purple are our board meetings. And you will start to see this get repopulated, reconfigured as we get feedback from all of you at our subsequent meetings. We're here on June 22nd. And then as we start to then operationalize our work over the next number of weeks, we'll update that tomorrow based on what we learned here tonight, and then bring pieces back to the board throughout. So this is just to kind of track our work and to show kind of the progress that we have. Also kind of a backwards mapping of where we need to be in the fall, where we'll be at a place where we'll be at a monitoring once we're able to launch. And that will be a piece depending on the situations with public health of really what our instructional model will look like and our ability then to be able to flex as needed to meet the needs of our kids. So this is just a real quick overview of really the opening framework and also then the timeline, which are two tools that we're using administratively to kind of guide our work as an administrative team. So that's really just more for your information tonight, but as those pieces start to become more specific, there'll be opportunities for you to see kind of what some of the high bodies of work are. The biggest pieces that we do have kind of coming back though into the fall really revolve around instructional delivery. So that's really where I want us to spend a little bit of time this evening. And Tim has put together a presentation for us that starts to talk about the delivery models. And earlier late this afternoon, he pushed out to you the draft of a survey that he wants to push forward to, or we want to push forward to our parents to get some feedback on these items. So tonight is really an informational piece on what some of these instructional models could look like. And then also a discussion of what are the questions that we're vetting out with our parents, and also looking for your feedback if there's any specific questions or any specific areas that you would like us to make sure we include in the survey. So Tim, I'll turn it over to you to take it from there.
Well, thank you, Randy. And I want to preface this next session by saying, all of this is based on the best information we have available right now. We did make some adjustments to the survey, and actually even this slide deck, since small adjustments since you saw it at the end of last week due to the DPI document that came out today. Now, of course, as the day has gone on, we've understood that DPI document is perhaps more provisional than it appeared at first. So we keep evolving with this process. But the first thing I want to emphasize is that our process is guided by some key principles, which we linked to in the preceding slide. But I want to talk about our planning assumptions first. And there are 5. And many of these you've talked about before. We need to be flexible. This is a unique situation, and our planning is going to be as complete as it can be, but some key decisions are going to be outside of our control and made by public health authorities. We know, we are assuming, I shouldn't say know that, but we are hopefully assuming that at least most of our students and staff will be able to return to our school campuses at some point in 2020, 2021, hopefully on September 1st. We also know that some students and staff will not be able to return to our school campuses on a regular basis until a vaccine is available. It's possible, and again, when we had Dr. Potoff on earlier, he noted that we've seen a recent uptick in Dane County that's being monitored for a trend. We've been very fortunate in Dane County to be touched very lightly compared to some other regions of the country. That's probably due to good luck rather than something inherent to Dane County. So it's possible that Dane County will experience heightened outbreaks of COVID-19 that may cause our public health authorities to revert to more restrictive phases of the Forward Dane Plan. We certainly don't hope that's the case, but we have to plan for that. And of course, the last thing is that the timeline for general availability of a vaccine or vaccines that will allow a return to pre-COVID-19 normal conditions is currently unknown. So we have to keep in mind we have a lot of scenarios to consider. We also need to understand that the way we open the school year is not necessarily how we will spend the entire school year. Conditions might become easier. Conditions might become more restrictive. We'll have to be flexible. Some of the things we're taking into consideration with the instructional model planning. Again, we did a lot of things on an emergency basis this spring, so a focus on academic excellence and acceleration of learning is going to be important to us this fall. At the same time, this has been very disruptive for everybody in our community and probably our children most of all. So we're going to take a very thoughtful approach to our whole child development and supports in our model. Because we are going to have some different options more than ever, it's going to be important to rely on our PLC process and framework to seek consistency and alignment. Flexibility, we've already addressed. We're going to think about models, more about that in a minute. We're going to have to consider what this means in all areas, the cores, the electives and non-cores, and also what this means for students that need additional challenge and kids that need additional support. And with that, we'll go to the next slide here. And you'll notice this has been adjusted since the one that was in board book earlier. These are the, and this is in response to the DPI guidance that came out today. So, and also discussions in the community. So possible instructional scenarios for the fall. On the left is the most restrictive scenario, remote learning for all. That's where we were in the spring. It's not where we are expecting with good luck. We hope not to be there at any point in the upcoming year, let alone September 1. At the other end of the spectrum is in-person learning for all. That's something we would really like to see in some way, shape, or form. Whether it happens with public health guidelines or we get a vaccine and things can get more back to normal. But we don't know when we'll be able to get to in-person learning to all. It could happen in early September. It could happen at some point during the year. We could also find ourselves in a situation where we don't see a vaccine in the upcoming school year and we never get back to in-person learning for all at a point during the 2021 school year. That's one of the great unknowns. In the middle is what many students will probably be experiencing as a learning model at some point this year, and perhaps most likely in September 1st. We'll have to see again where our Dane County guidance comes in. But these are the hybrid models. And again, we may shift between all of these scenarios based on conditions. But the hybrid models we're looking at are alternating days, kind of an every other day model, a day in school, a day at home, repeat. A 2-day rotation where students might come for 2 days in a row to school, then 2 days at home. And I think it's important to note that on both of these two scenarios, we are envisioning that we probably need a 5th day of the week, whether it's a Wednesday or a Friday, that would be a day where students are remote. We might use that more for office hours and flexible differentiation and intervention time for students, but virtually. And we might need it for some extra staff planning time to maintain alignment between our different models. Other options that we are assessing are alternating weeks, where students might come for a week at a time and then learn remotely a week at a time. And kind of a different type of rotation that is by grade. And, you know, I think there's been some discussion about how we would group students. Something we've started to look at, and I actually do have a data poll on that, that we need to break down by school, but we have broken down all of our households by alphabet into 2 groups, and we're beginning to look at how balanced that is across all of our grade levels. It makes a lot of sense, it would seem at first glance, to try to do this on a household basis rather than a school by school basis. But we need to kind of do a little more analysis on how those household numbers pan out. Before I move on to our next slides, I want to pause for a moment. You've seen this before, it's been in board book, but you have questions about the different components in these scenarios before we move ahead any further. That's why we call it excruciating wait time. We can go on to the next slide. Now, this is another way to think about our scenarios. And this is just a decision flow chart. And at the top, our box or container is whatever decision or whatever phase we find ourselves in under the forward DANE plan. Now there's a restrictive lane that's all the way on the left, and that would be if we were in a restrictive scenario, safer at home or phase 1. Currently we're in phase 2. So that more restrictive scenario would probably only happen in response to a significantly heightened outbreak in the community, but that is for public health to decide. Currently we're in phases 2, and we hope to be in time in phase 3. And I think on a student by student basis, the question is, does the child have a health concern? And of course, this could also extend to health concerns in the household and is able to return to campus. And if the answer is the child does not have any health concerns themselves or in the household, then yes, takes us to either hybrid learning, and we just looked at some possibilities for that, or full-time on campus under various package of safety recommendations provided by Dane County Public Health. But we know we are going to have some students who do fall in the medically high-risk category or may have members of their household who fall in a high-risk category. And they may have, under advice of their physician, a recommendation not to physically return to campus until there's a vaccine. In which case, that's going to be a remote learning at home scenario based on individual need. Now, this box really is referring to something being based on the child being medically at risk or someone in their household being medically at high risk. We do know anecdotally, and we will hopefully through the survey that we'll put out this week get a better sense of how prevalent these perspectives are. You know, we do know we may have some families who, even if nobody meets the high risk criteria, they may be reticent about sending their child to school while the epidemic's ongoing and prior to there being a vaccine. We also know, anecdotally, we may have a certain number of families that may feel like the package of public health recommendations for safety that we may need to put in place might not be a good fit for their child, even if we do make some individual accommodations in them to reflect the individual needs of kids. And of course, the right-hand lane is a phase 4. The new normal, that would probably be a scenario where the vaccine or vaccines had been fielded, generally available. And at that point, and it's a day I think everybody is very much looking forward to, everybody's back full-time on campus with no kind of restrictions or health safeguards, special health safeguards whatsoever. So this is a different way to kind of think about just the flow chart of decisions that we would see students moving through. So as Randy mentioned earlier, we're looking forward to launching a more in-depth reopening survey to our families this week. We made some adjustments to it today based on the provisional guidance from DPI. So I did share copies of it with you kind of late this afternoon, but I just kind of want to speak to the general organization of the thing. First of all, I want to emphasize for everybody out there, this is there are a lot of pieces of information that are going to enter into our decision-making process for our instructional delivery models for the upcoming year, both for the fall and over the course of the year. This might be the most important piece of information in our decision-making process. It is going to be very important that we have as complete a family participation in this survey as possible. We really want people to take this survey. The first section is going to take people through a set of groupings based on instructional levels, elementary, intermediate, middle, and high schools, with similar questions, but grouped by level. So if you have students in multiple levels in your household, this is where the survey might get a little long, but we need to do this because these are questions where we can see the feedback varying by the age of the child. And so the 5 questions in this section would be, do you expect to send your child in person in September, whether it's full day or hybrid, but just your child is going to come to school in some way, shape, or form. What are your intentions with transportation? If you, in the transportation section, there's an option that says you anticipate keeping your child at home for remote or virtual instruction. We have a question on timing. It might be complicated for us in our planning and master schedule development if we have a lot of moving in and out on a rapid and unpredictable basis of students between remote learning and on-campus models. So we do have a question that asks about making commitments for a term at a time, trimester, semester, something like that. We have questions about what improvements parents would like to see for virtual learning if it's needed. We've already asked parents a lot about it, but we are going to ask again. And then also a very critical question that's on a lot of people's minds is the impact of different schedules and childcare availability on their ability of their student to participate. So those are the 5 in the first section. And then there's a second section that's not differentiated by level. And there are 7 questions in that section. We ask about what concerns families might have about their child returning to school, what might make them feel more comfortable about their child's return to school. Then we have some questions on the hybrid models. What do they view as more manageable for their family? What do they see as the potential learning benefits of the different models? And then we also have a question where we just solicit open-ended perspectives on the hybrid models. Then we ask a question about how comfortable families would be with the possible combination of reopening precautions. And again, It's probably going to be a package. I mean, it's not rocket science what this is going to be. It's probably, I mean, and I know we haven't made any final decisions, but you look at public health recommendations, it's going to be some combination of wear a mask, wash your hands, keep your distance. I mean, there's more to it than that, but there are going to be some different ways of being in school this year than in the past, and how comfortable are people with that? And last but not least, and I'm trying to remember who raised this question, Mark, it might have been you. We do have open-ended feedback asking parents, what do they feel they or their children need in terms of information or workshops or training to be ready for the upcoming school year? And certainly, you know, our package of safety measures in the school, we will need to introduce that to our students. We'll need to introduce that to our families. And we will need to provide support for our kids to learn whatever the expectation is going to be in school. We also know we're going to have to provide, wherever we deviate from business as normal, some coaching for kids on how to advocate for themselves in the system and how to maximize their learning in whatever models we eventually select. So that's kind of the high level on the survey. And we really would like to get that out this week. Any questions on the survey piece or anything else that I've covered in the last few minutes here? Or feedback?
As far as instruction, do we have the capability of running live classes for those kids who don't want to be in class for every single class? Or how do you foresee that running?
So Brian, let me just clarify on your question. Are you talking, when you say live, are you talking kind of all the time, synchronous, just like they were in the classroom?
Exactly. Somebody could watch it from their home, but during the actual class.
Yeah. You know, that's a good question. The answer is probably not the whole time. But I'm going to say probably, because, you know, if the numbers of students that end up needing full-time remote learning is very low, something on the order of 1 student per section, that's not a lot different than homebound instruction when we've had a student due to a health concern that they've been out for a while. And I can tell you there have been times over the years where at points of the day, we've really set up video conferencing real time for significant blocks between the class and the home. But that's been on those were very limited cases. And so I think what you would see, and again, it depends on a huge question here, Brian, is how many students will be in these remote learning models. I think if it gets to the point where we could assemble a remote section per course or per grade level, then we would, work with me. Imagine that your boys were younger. Okay, imagine they're in elementary school.
No, I don't want to. They're fine in high school.
You can use mine for this thought process.
Okay, I'm going to work with Mike's kids. Thank you, Mike, for volunteering your children. And if one wants to come into the video here, that's a-okay. But you know, if we have very few kids in virtual learning, we might decide treat it more like a homebound education situation, and they might actually stay as part of the standard class grouping that they would be if we were in a business as usual schedule. But if the numbers get to be more of a cluster per section, we think that's going to be challenging for a teacher to manage that large of a group remotely, plus the students that are either in school full-time or in a hybrid model. And in that case, we would probably look to do some reallocation. And again, these are decisions we haven't reached yet, and it's partly why the survey is so important. You might have a remote learning 3rd grade section in the district, and we might have a teacher, and we might have to kind of modify some of our plans for fall placements, who their job would be to facilitate that remote section until such a time as we didn't need that remote section anymore, or potentially, if the year develops this way, potentially through the entire course of the year. And so, that's really, I think, Brian, going to be a key fork in the road in terms of what we look at for a delivery model. Is this going to be a case of one kid per section, or is it going to be enough students that we need to develop standalone sections?
Thanks. I'm assuming it'd be the same too, to look at spreading out students in their non-traditional school as well, yes. Whether it be, just numbers, whether part of the middle school would be used or elementary or something like that, to just spread out kids more if the middle school was off one day.
Yeah, I think a key thing to keep in mind, there are ways to free up space to spread out students. And I think this is one reason why DPI is maybe making bigger revisions earlier on the guidance. An important aspect to spreading kids out, the space is actually in some respects the easier part. Who is the teacher as you spread kids out? So, one of the models that was in the DPI package that was released this morning was all the lower grade kids are in school. All of the secondary level students, for us that might be middle and high school, are learning remotely, and you spread your K-6 kids into your high school and middle school for spacing. Well, from a square footage standpoint, you can do that. But who's teaching these sections? Because the middle school and high school teachers are delivering remote instruction for the older kids. And when you saw that 10-to-1 ratio in the DPI document this morning, we have projected for this fall about 4,150 students, kindergarten through 12th grade, across the district. Even if you count our speech and language pathologists, library media specialists, school counselors, the whole kitchen sink of licensed educators in the district, we only have around 350 licensed educators. So, even if we threw everybody we had at this full time, we couldn't, and that's not allowing for duty-free lunches, it's not allowing for prep periods. We're not close to being able to do a 10-to-1 ratio. So it's not enough to be able to have the space to spread the students out. You need to have the teachers to facilitate these small group sections.
Thank you, Tim. Some of my questions are just questions I'm hearing in the public that I want to get out there.
Oh, it's a natural question. I've heard it myself, and we're still at the stage where we don't have hard answers for all of these, certainly.
So, Tim, you're saying you want to get the survey out this week. When
Yes.
would you think you'd have the results compiled by?
Well, usually we get probably 2/3 to 3/4 of our results within the first 72 hours of a survey in the field. But if we were to launch the survey tomorrow, we would probably look to close it on Monday the 29th, give people a full week, with it. We would put out some reminders to people to take it. It's going to be extremely important to have high participation. So we wouldn't have our final results for about a week, but I think if there were clear trends or very mixed trends, we would probably know that by the end of the week if we can launch it tomorrow.
Are you saying the end of this week, or you mean the end of the following week?
We would have some preliminary data by the end of this week that would make it pretty apparent if something was a clear trend one way, or if we had a mix of opinion. But the final information, and also we have open-ended questions on there, and until you wrap it up, you could really have some very helpful comments in those open-ended questions. We wouldn't probably have that till sometime in the middle of next week.
I'm just wondering that with the board having to make their decision at the next board meeting, that we'd have access to all those results as soon as we could. so we'd have time to read them and then do any follow-up questions we might have with you.
I think that would be, for the meeting on the 9th, that would definitely be feasible.
Well, I'm wondering about maybe getting it out to the board members, the results, just emailing out the results like the week before the board meeting.
Oh, that's what I mean by very feasible. In fact, I think to kind of aid you in your decision making, we would probably get you the in-progress numbers even before we close the survey, just so you could kind of see where the trends were going.
I would just suggest renumbering a lot near the end of the survey. That one question number disappeared and some of the other ones seem to be out of order compared to what you presented. But,
so when you see that in the Word document, so that's just the way Qualtrics puts that in the Word document. If you actually were to take the survey link, you won't see those question numbers.
Oh, it actually works. Okay. Are there any other questions about the survey or input?
There was one part, Tim, where you had to evaluate the effect it would have on your family, and one criteria was listed twice. I believe it was at the intermediate level. Anyway, double check that. You had criteria that came out twice.
Okay, I'll go back and check that, Joan. Thank you.
I guess one question I would have is does the board have anything that they would like tested in the survey that isn't right now being queried?
And as long as we're talking about getting input from the public at this point, I think for most of us, probably our biggest worry is that there's going to be all these instructional models, the concepts of masks and everything else that the survey will help us with. But you're sending this only to the parents. And we do have, obviously, the rest of the community plus the parents as far as being board members that we're responsible to. This past week, I know Mike was part of a Zoom thing that had some of the public talking about the school and wanted to provide input. I'm wondering if the board would be interested in maybe middle of next week setting up a more formal Zoom listening session where it's only a listening session where we let the public come up and address us actively and say what they think and what they're feeling based on what this meeting was and what they're hearing in the public, as a way for us to get a more direct input from them in a more real-time basis before we have to make a very big decision next month. Would other board members be interested in just being in the listening part of that?
Mike, how many people did you have the other night?
In terms of active participants, it got up to about 20, but I did post the video later, and I think it's been viewed about 200, 250 times at this point.
I think a lot of comments early on, I believe, Mike, was that people, I know you did it at a time that Sam worked for Sam and everything, which
Right.
was at 3:00 in the afternoon, and people wanted it more later in the evening so they could participate.
Right, and I got about 12 to 15 people who emailed me comments too, and I said I'd pass those along to the rest of the board at some point as well too. So there is certainly no lack of people who want to give input, and I think it's very important that we give people the opportunity to tell us how they feel about this, whether we agree or not. I think people need to get that voice.
Is your vision for that, Dave, to be open it up and just be a pure listening session, or do you see any piece of wanting administration to provide any background on some of the things, for example, like what Tim shared here, and then a listening session kind of after there's kind of like a base of information? Is there
I don't think, I mean, based on how the way Mike's worked, a lot of people who participated did seem to look into stuff ahead of time. I think we could announce it and provide the links to this stuff, just like we, just provide them links to the agenda and the material that was presented. But to actually sit down and do a half-hour presentation, I don't think that would be what the people are interested in, based on what I've been hearing. It's more just it's just sort of like we've done before with listening sessions in the public, but because of it being a Zoom meeting, I'm not sure I'd see the value of any sort of presentation, because the people who are coming already know about it. They probably already looked partway into it.
Do we need to have a full board presence at that?
I wouldn't think so, because we can do what like Mike did, which is we'll record it and then post it, and any board member who didn't want to actually be there listening actively can watch it later. I mean, I wasn't able to do Mike's because of my work, but I was able to watch the hour of it later. It wouldn't have to even be a board meeting, because we are not having a discussion among the board members. We are not voting on anything. I don't think it would have to be posted.
And that was my question, was do we all need to be there? Not that we don't want to be, it's just two people do it and the rest of us sort of sit back and watch.
Yeah. So when I did the webinar here on June 2nd, I posted all of those just so that there, in case there was a quorum of the board, and then just stated that this was meant for this purpose. There was no actionable items, and there was going to be no action by the board. And similar to how we've done it for like going to state convention. So if you were going to do a listening session, I'd probably do it that way, just so that it's just also another venue just to get the information out there.
Oh, that makes sense.
Yep, I'm in agreement with that.
Okay, so if we set this up, would people prefer Wednesday, or looking at the calendar and giving people time to see what we've already done tonight? Also, the survey will probably generate more interest for people to provide input. I was thinking of Wednesday or Thursday of next week at like 6 p.m. Anybody have a preference for which day?
Do you have any concern, Dave, with it being tied right up against the 4th of July weekend? Would that
would be the one reason to not do Thursday.
Right, yeah. So
because a lot of people I know get Friday as their holiday.
Right.
So maybe that's the decision, is we just say
Wednesday.
Wednesday.
I think Wednesday.
All right. I'll work with Randy to set that up. I assume we can use the school Zoom account, give you time to notice it, as you said, and then we'll start publicizing it through social media, because that's the group that will jump on, and we can maybe even send something out through Infinite Campus. Okay.
You and
I guess the only caution that I'd have there would be, obviously what these guys are trying to do is set up for opening up the school and so forth in the future. And I guess I hope that we wouldn't slow that process down. And the survey, as Tim presented it, is really affecting the students that are in the system right now.
This shouldn't affect any of your planning, should it, Randy?
No, I mean, I think what it's going to do is it's just going to inform you on hopefully some of the items you're making a decision with on the 13th. I think that's what I think your intent is. No, I mean, my only questions are just logistical, which you and I can do offline. And then also if there's anything you want from us administratively, and we can talk about who you might want from the administration to be present as well.
Yeah, I don't see this as really even answering questions. I mean, people may have questions, and we can get those as ways for what we should be looking for, but not actively answering questions on this listening session.
Do you plan on having a time limit on the Zoom?
Yeah, I would say I'd probably limit it to 2 hours. I mean, Mike did his in an hour with about 25, 30 people. I think we could do that, and then, of course, limit speaker time to make sure everybody has the chance, and then you queue them.
Now, I was going to suggest more similar to the time frame Randy used for his 2 Zooms. And then secondly, who's going to be in charge of getting it posted? So I can't guarantee I can be there that night, but I certainly would like to view it.
Yeah, I'll work with Randy about that.
I'll get it posted. You and I can talk, Dave, if you wanted as like a Zoom like this, or if you want to put out there as kind of a webinar where we can bring people in to make their comments. A little bit more controlled, so we can do it either way.
Okay. Then is there any other questions about the input or the survey or what Tim put up?
Great.
Thank you, everybody.
Thank you, everyone. The last item is yours tonight, Dave, with regards to how we move forward with our meetings.
So obviously, as the school opens up and the buildings start opening up, that also means how do we start doing board meetings? And right now we're obviously 100% virtual, but as of July, there's the possibility we don't have to be. And Randy and I wanted to get an idea of how the board members felt about how we would return to in-person board meetings, or if we do a hybrid of that, allowing those board members who would rather stay virtual that they can and still fully participate. And then, of course, we could do social distancing appropriately at Bethel or somewhere else if we felt that was a better venue. So I guess the first question is, how do people feel about going back to in-person board meetings come July once the district starts opening up the buildings?
I would say that would be fine. That'd be great. And I would probably suggest that it be a hybrid, so if people didn't feel comfortable going to the board meetings in person, they could still participate.
Dave, do you feel we should set up any criteria? In general, I think it would be great to get back to face-to-face. If people have traveled, if they fly, do we want to think about any quarantine for activities, or just social distance and not worry about activities?
Should we be under the same rules that we're putting the employees under about self-reporting?
Yeah.
I would think that would probably be best. Does everybody agree with that?
I agree with that.
So we should have to do the same self-checklist that we are asking staff to do for attending anything in person. I'm guessing Randy.
If we've been involved in large gatherings, that we don't attend because of the potential for having come in contact. Is it, or are we just going to self-regulate? If we don't know, we don't know.
So under the criteria we put for staff, I don't think large gatherings was a check, was it? Randy?
I don't believe so.
I don't believe that was in the checklist. That's not to say any one of us couldn't ask or decide that that was an issue. Do we have the capability in the boardroom right now that if someone wanted to attend virtually, we can handle that?
That's one of the things that we're working with the IT department on. We believe we have a solution to figure out how to do that. It would probably be, if you were on a Zoom meeting, we would do similarly to like what I'm sharing my screen right now, we would do on the big screen. And then the rest of us would be present in the room. And then we have to work on a few of the audio pieces so we don't get feedback, et cetera, by everybody having it in front of them. But yeah, we're working on a hybrid option there.
Okay.
I think it'll work.
So, and we have until July 13th to get that covered.
Yep. You could also decide if you want to do July 13th virtual and you want to come back for the second meeting in July. I mean, we can make that decision. Just tell me where you'd like us to be and we'll figure it out.
Okay, so.
Well, the other thing too is, David, the other thing you could do if the Zoom doesn't work, you can also call in. I've called into several board meetings.
I We
Well, I was
have done a
driving-
call in on an occasion. That would work automatically if we didn't have more than one person. So let's do it this way. All those in favor of July 13th, say aye.
Aye.
All those, Joan said aye. All those opposed to starting on July 13th.
Nay.
Okay.
Yeah, I'm sort of a nay on that too.
I mean, my understanding is that we're still telling staff that all their meetings should be remote, so I don't know why we're in such a big hurry to change it ourselves.
Oh, it's not about being in a big hurry. It's just we have to start that discussion at some point, and we have to give Randy and his people time to know we're going to do that, and we have to post it appropriately in the agenda where we're going to be.
Would it be?
Maybe it makes sense to make it then our second board meeting in July.
Okay.
I'm sorry, go
So, who would like all those in favor of the second board meeting in July?
Aye.
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 All those opposed, looked like everybody said aye. So it looks like we'll be doing our first hybrid meeting, potentially in the second board meeting in July. That takes us to the second part of this, was about the idea of our summer board retreat, which many of you had expressed a strong interest in, but of course we haven't been able to really do because it's been my feeling that a lot of the issues that some of you want to address would be pretty difficult in a Zoom meeting. So I was kind of holding it off until we get back to in-person. So maybe what we would do is in that second July meeting, we could discuss possibly holding it in August. But we might as well wait until we see what calendars look like closer to that event, if that's all right with everyone.
I like
Good
that.
idea.
So that pretty much covered everything on the agenda. Was there, oh, Randy, there was a big comment from someone that should have brought up earlier. The 4K status assignments was not addressed in anything I saw. And some parents have been asking about that.
Yeah, and I do have an answer to that. One of the things that Amy was waiting for was that 4K is under a little, because it's in a preschool setting, they're in a little bit different guidelines area than a public school. And so when you look at some of their size restrictions, they were waiting to see what some of the guidelines were going to be that were coming out of public health that was supposed to come today, so that then they could make appropriate placements based on number of kids in each section. Obviously that information didn't come out today and we're anticipating it later this week, but some of those pieces that have delayed it are the reason why there hasn't been a decision yet. So that'll be coming out as soon as we're able to kind of pull those pieces together.
So potentially next week, maybe the week after.
Yes, I would say somewhere in there. Does that seem accurate, Tim, in your conversations with Amy?
You're muted, Tim. Tim, you're muted.
Yep, I'm not. Yeah, I mean that's consistent with what we've talked about, today. Again, all the caveats about changing guidance, but yes.
Yeah, so that's what slowed it down, Dave, was just trying to get some of those guidance, and potentially if the numbers were, if they could get class sizes low enough, giving some additional opportunities to kind of hold some of those classes more consistently.
Okay, then, if there's no other questions or comments, I guess we take a motion to adjourn.
So moved.
Motion to adjourn. Second.
All those in favor, say aye.
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 All those opposed? Thank you very much, everybody.
Well, thank you, everybody, for your patience this evening.
Have a good night.